most commonly asked topics. We should not miss any of them. So let's start with the images of mother and child. As you can see in this first image, there is black color mother, black color child Lux program, which is, I hope you all know, improvement of facility in maternity ward and labor room. And then if you see this white color mother, white color child, that means they are talking about some foreigner program. This is baby friendly hospital initiative, and this is WHO recommendation to promote breastfeeding, and BFHI do not focus on prevention of infection. This is not a focus of BFHI. Then this program, which has incomplete mother and child, as you can see, is written Prime Minister Matru Vandana Yojana, means mother worship program, in which 6,000 rupees is given, 2,000 rupees at 12 week when mother come for first registration, 2,000 rupees at 26 month of pregnancy, and then last 2,000 rupees at 6 week when she come after delivery for first dose of 5 vaccine to the child. So these are the 3 programs with mother child. Then the 2 more program is this yellow color mother, yellow color child. This is JSSY, Janani Sishu Suraksha Yojana. Sisu keep doing susu. So due to that susu urine, it is yellow. And in GSSY, as you all know, there are 3 free things they give. First of all, there is free investigation and free treatment. This free investigation and treatment is for pregnant mother for 42 days after delivery, and for infant less than 1 year. In every government hospital under JSSY, these are free things. Then there will be, of course, free ambulance. The number for ambulance is 102, mother child 2. So 102 number, 108 is for other thing. And then there is free food, which is for 3 days if it is normal delivery, and 7 days if it is C-section delivery. Okay. So this last program with blue color mother, blue color child is UNICEF. And as you all must be knowing that UNICEF focus on mother and child health, and UNICEF also fund seed and manure of applied nutrition program. Okay. Which is a neat PYQ. तो देखो बिडू लोग, बात क्या है कि they also ask, these are 5 mother child, and the last mother child logo is this Anmol, which is ANM online. And what is Anmol? Anmol is tablet based software given to ANM for data entry and follow up of high risk pregnancy cases. Okay, for follow up and data entry. Okay, 2 work is there by Anmol. So there are 6 logo with mother child. I hope you will remember this 6. Black color is Laksh, white is BFHI, incomplete mother child is Matru Vandana Yojana, blue is UNICEF, yellow is GSSY, and green is Anmol. Then if they give you this logo with pen and screwdriver in the same hand, that is Skill India Kausal Bharat, in which there is 2 things they are giving. One thing they are doing is giving low cost or low interest loan. Okay, low interest loan. And second thing they will do is the training of people to start business. Now this second logo is, you can see here, is of Atmanirbhar Bharat, and in Atmanirbhar Bharat also first thing is common, that they are going to give low interest loan. But along with low interest loan, the second thing is that they will also decrease import so that India can be self-dependent. Atmanirbhar, okay, decreased import. And so this is a bird which is not flying, bird with 4 legs, and that's the self-dependent India. Now one more thing I want to revise here is, I told you that white color mother, white color child is baby friendly hospital initiative, and it do not focus on prevention of infection. But there is one more program, Navjat Sishu Suraksha Karyakram. This focus on prevention of 2 things, prevention of infection and prevention of hypothermia. because in last FMG exam they have asked which of the following is not a target of NSSK. So it focus on two things: prevention of infection and hypothermia. If you are able to save the child after infection, hypothermia, then we will do exclusive early breastfeeding, and if we are unable to save the child, then we will do neonatal resuscitation. So these are the four things: neonatal resuscitation, prevention of infection, hypothermia, and exclusive breastfeeding in NSSK. So NSSK focus on infection prevention, but not BFHI. Now after this, this logo is of SIDA. SIDA start with sputum, and SIDA fund TB program. As for SIDA, as for sputum, it fund TB program. Okay. Then this is the logo of DANIDA, and this is the logo of UNESCO. UNESCO fund educational program and all. It is United Nations Educational Scientific Cultural Organization. The headquarters of UNESCO is in Paris. And DANIDA fund I program. So how will you remember it? Dan is there. Dan means donation. And so donation, it fund I donation. Netra Dan. And so it fund I program is DANIDA, sputum program, SIDA, TB program. This logo is very difficult to identify. This is United Nations Development Program, which funds Sustainable Development Goal. And I hope you know Sustainable Development Goal given in 2016 to be achieved by 2030. And the third goal is for health. In the third goal, which is for health, it has been asked 3 times. What is the target for maternal mortality ratio? 70. What is the target for neonatal mortality rate? 12. And under 5 mortality rate? 25. So 70, 12, 25. 25 for under 5, neonatal 12, MMR 70. Other than that, in SDG, they have said that 1/3 should be the reduction of premature, what? Not ejaculation, premature cardiovascular death. 1/3 reduction of cardiovascular death. And they said by 2030, we will eliminate TB, HIV, and all neglected tropical disease. So like malaria, leprosy, everything will be eliminated by 2030. So these are the target for 30, all these 5 target. Only one target was of 2020. That is reduction of accidental death to half. Accidental death half by 2020. And actually in 2020, Corona came, so accidental death became half only for 1 year. So only one target was achieved, that is also for 1 year, that is accidental death reduction to half. So these are the target of SDG, do revise them. This is the logo of World Bank. World Bank, W for World Bank, the headquarters is also Washington DC. Anyway, the international currency is dollar, so because it is in the capital city of USA, so that's why the dollar is the international currency. Washington DC is the headquarters, World Bank. This is the logo of Poshan, and you can see a tree going on. This is Poshan program. Under Poshan program, there is one thing which is PM Poshan, which replaced midday meal. In PM Poshan, we give half protein and 1/3 calorie, because in most of the part of India, mother and children are eating rice, so they can get calorie from there, but not protein. So we give more protein, less calorie. Second thing is, in PM Poshan, nowadays, they have added preschool children also. Previously, KG school children used to get food only from Anganwadi. Now, in PM Poshan, they can also get it in the school. But they are not coming to school, but still they will get it there. And remember, in Anganwadi, up to 6-year age children go. And in Anganwadi, the growth chart which is there is weight for age. Then second thing under Poshan is this, of course, Anganwadi program, which I said that in Anganwadi, the age is up to 6 years. And the growth chart is weight for age, because weight for age tell about both thing, acute and or chronic malnutrition. It tells about both. That's why weight for age is used, because we can detect both the things. But if they say weight for height, if it is low, it means height is good, weight is low. Banda sook gaya hai, it is wasting. So wasting means it is talking about acute malnutrition. low weight for height. And we all know if it is low height for age, this low height for age means height has not grown, so it indicates chronic malnutrition. Do remember one very important thing, that in portion the target is 2% reduction of all this thing. But in Anemia Mukt Bharat, the target is 3% reduction of anemia, but portion 2% reduction. So first is PM portion, second is Anganwadi, third thing under it is RKSK, Rashtriya Kishor Swasthya Karyakram. Kishor means adolescent, 10 to 19 year. For their program, that is here in this. Fourth under it is of course Anemia Mukt Bharat, about which I was saying that the target is 3% reduction is the target, portion 2%. Then other than this, there is also one Poshan Abhiyan, which is under this Poshan program. Poshan Abhiyan is just awareness program for 2 weeks, in which government people will go door to door and will tell people ki khao be, khate ka nahi ho, eat dear, why are you not eating? So they will say give us money or job, we will eat. But government is just going to give awareness on nutrition in this Poshan Abhiyan. Abhiyan means mission, Poshan means nutrition, so it is for 2 week awareness program. So do remember this 5 things which come under Poshan and the target 2%. Now they can give you peripheral smear of the gametocytes. If it is banana shaped gametocyte, as you can see, it is falciparum, but if it is granulated, it is vivax. And you can see it, granulated RBC is vivax, falciparum is just banana shaped. And do remember, both this banana shaped and vivax, these are detected by thin smear, not by thick smear. Thin smear of malaria slide. Thick smear only detect whether malaria is present or absent. Thin smear detect species, which species is there. Now, my dear friend, if you are online listening to this, can you guess this slide? Is it vivax or falciparum? Nikhil bro, can I see some chat response? Is it vivax or falciparum? Please do let me know. And do remember, thin smear detect species. Thin and thick both smear are made by multi-purpose worker, which is same as health worker male. And this multi-purpose worker or health worker male do active surveillance. They visit every house of the village once in 14 days, and they make 2 blood smear from all fever cases. So this 2 question has also come. Now, hello my dear friend Shivam, Lone Bilal, Medcofil, all of you are welcome in this session. The purpose of this session is to revise the key points, very important key points quickly, which can be expected to come. Plus, if you have any doubt, anything you want to say or ask, do let me know. One advice which I would like to give you is, on the exam day, don't read the revision of notes and all, these are not good. On the exam day, read your strong subject, because that will give you the confidence, and with confidence you can solve a lot of questions. Plus today, if you don't have left something important, then focus on PYQ, because if you will read theory, mind can get diverted. But if you will do PYQ, our mind has the defective setting that once we started developing PYQ, then we will be directly focused on the answer. If one question is put in our mind, then we cannot get diverted. And you can do PYQs in last day, but don't go for much theory revision. Rather than that, read your strong subject on the last day and do some PYQ. That will give you confidence, and with confidence you can perform very well. Let me know. Yes, I have, from the bottom of my heart, I pray for very good result and for success of all of my friends who are there. Do let me know if I can help you in any way. Okay, my number is there, 8860796675. You can let me know if I can be of any help to you. If you are under any kind of stress or anything is bothering you, let me know. But some stress is okay, and some stress is good. Plus, one more advice I want to give you is that I request you that after 7 or 8, after 7 p.m., I will request you to switch off your phone, otherwise you will not sleep. Plus, if you don't sleep, don't be so worried. It's okay. Try to sleep, but if you are not sleeping, it's okay. Without sleep also, students have passed, have scored. Even second ranker in NEET has talked to one of my psychiatrist friend, Ankur Jain sir, and told that he was sleepless and still get the second rank. So if you're not sleeping, don't stress yourself too much. On the next day, take some painkiller like Combiflam or something, and that will cause gastritis. So along with that, take some Omage tablet or Pantop tablet. Omage will be 20 mg, Pantop will be 40 mg. Take some breakfast, and without breakfast, don't go for that. And go for this in the morning, wake up, take a bath, pray from wherever you believe, have faith, and take blessing of your mother of Almighty. And then even if you are not asleep, it's okay. Why I am saying that it's okay? Because if you will give too much importance to sleep, sleep is like your ex, and if you will give too much importance, they will run away further. So don't give much importance and you will sleep well. And just switch off your phone so that you can focus better. If there is still anything I can help you with, let me know. Chalo, now, nothing is to be worried. Some anxiety is good, some stress is okay, but try to think all the positive things, all the party which you will do after passing. And if you will fill your mind with positive thought, negative will be replaced. That's the only way. So think how much you will party, with whom people you will party, where you will party, how you will party, and the mood will be good and exam will be good. And on the last day, focus on your strong subject, strong area. Now, can you guess me this? This smear, if you see, again they are granulated RBC, and if it is granulated RBC, it's always Plasmodium vivax. Okay. Now, if you give an image of larva which is floating parallel, that's Anopheles larva. Anopheles larva float parallel, and we all know that Anopheles is also known as sophisticated mosquito because it breed only in clean water. So you can see there is a clean water. Larva is floating parallel, so it's Anopheles. Okay. Now, which image is this? This is the image of louse, head lice. And louse or head lice transmit 4 diseases which can be remembered by the mnemonic PUT. And when you kill head lice, the sound produces also PUT. So the mnemonic is PUT. What is P? P for pediculosis, E for epidemic typhus. This question usually come in exam, that there is a human which is being bitten by insect, and after being bitten by insect, this human, he develop fever with rash. So which is the disease and which is the causative organism who transmit it? So in 99% cases, the disease is epidemic typhus, louse transmit it, and the causative organism of epidemic typhus is Rickettsia prowazhaki. Prowazhaki. So there is a lot of power, prowazhaki. That's why it is causing epidemic typhus. Okay. R stand for relapsing fever, and T stand for trench fever. So relapsing fever, trench fever, pediculosis, epidemic typhus, 4 thing is transmitted by louse. And do remember, trench fever causative organism is Bartonella quintana. So they have asked this question, which transmit Quintaniac fever. Quintaniac fever is same as trench fever, and it is transmitted by louse. But who transmit Q fever? Q fever transmitted by air. So Q fever air, but these 4 by louse. Do remember them. Now, what is this image? Can you tell this image? Very commonly asked question. This is the image of castle neck appearance, which occur in which disease? It occur in pellagra. Pellagra is due to deficiency of niacin, because when niacin deficiency occur, tryptophan synthesis decrease, and that lead to pellagra, which has 4D, diarrhea, dermatitis, dementia, and death. So you can find this very peculiar image, castle neck appearance. Very good. Anushka Patel was correct in answering that it was vivax there. Okay. Now this image can come. It is the image of, can you guess the deficiency, which vitamin or which deficiency is there? They will give you the history, that there is history of eating raw egg white, and after eating raw egg white, this feature occurs. So it is deficiency of biotin, and this biotin deficiency cause red head with less hair, which occur due to eating raw egg white, because raw egg white has avidin. Avidin binds with biotin and causes its deficiency. Yes, MEF block has correct answer. Niacin was there. If you give the image of teeth with white streaks, this is definitely dental fluorosis. When the fluorine amount is usual range is 0.5 to 0.8, but when it is more than 0.8, then this kind of deposition can occur. They have asked this question also, what is the range of fluorine in water? It's easy to remember because chlorine is also around the same 0.5 to 0.7 in drinking water. But in swimming pool, chlorine is 1. So fluorine 0.5, 0.7, 0.8. If the fluorine is less than 0.5, क्या होंगे? There will be दांत सड़ जाएंगे, dental caries will occur. But if it is more than 0.8, fluorosis will occur or brittle bone can occur, in which there will be history that with minor activity, like in the morning, patient will come and say, in the morning I was going to potty, I was sitting and my leg break. I was waking up and my leg broke. So what advice will you give? You cannot give advice that do potty while standing. And they will sit somewhere. So the advice which we give is use a kit which has 3 things: lime, alum, bleaching powder. It is Nalgonda technique. It will remove the extra fluorine, and then this fluorosis, extra fluorine will be removed, so brittle bone or dental fluorosis will not occur. Okay, very good. Medico will remember it. Now, if you give you this image, in this image you can see patient are walking on toe, and they are walking cross leg. So, walking on toe, cross leg. This is typical of neuroletharism, which is due to poison boa, beta oxalyl aminoalanine, and the treatment which we give here is vitamin C is the treatment. Other than vitamin C, we can also do parboiling, and we can keep the khesari saag in lime water overnight and remove extra the poison boa. Okay, this is the poison. But we have to revise food poisoning for sure. One very common thing they ask is that someone eat groundnut or maize, and after eating groundnut and maize, they develop hepatocellular carcinoma and of course of liver. What is the poison? So the poison will be aflatoxin. If they gave the history that someone eat wheat or rye which has black color ergot, which lead to cyanosis or necrosis of finger, what is the poison? Then the poison will be ergotoxin, and ergotoxin is in ergot, and this ergotoxin, just like ergotamine group of drug which relieve migraine pain by causing vasoconstriction, this is also causing vasoconstriction leading to cyanosis, necrosis of finger, and it can also cause hallucination. Now, the main confusion which occur is between epidemic dropsy and endemic ascites. So, if it is dropsy, they will give history of mustard oil contaminated with seeds of Argemone mexicana. They call it Satyanasi destroyer. So, if they give history of mustard oil, it's epidemic dropsy. And in the symptom, they will say that patient have bilateral pitting edema, congestive heart failure, and dyspnea. Okay, pitting edema on leg and congestive heart failure. So what will be the poison here? The poison here will be sanguarine. S for sanguarine, S for sleeping. So let's say you are sleeping together with someone of your dream. If you sleep, there will be dropping of eyelid now. So sanguarine lead to dropsy. And as you can see, the symptom is also pitting edema. Pitting means dropping inside. So that is dropsy. But if they say the question endemic ascites, endemic ascites is due to which poison they ask? The poison will be pyrazolidine. And P for pyrazolidine, P for pate, abdomen. The poison is pyrazolidine, and it is leading to swelling of pate, swelling of abdomen, ascites. And it is due to the plant Crotalaria with seeds of Panicum miliare. So these 4 is here, and the last 5th is neuroletharism by Khesari. Do revise them clearly. Now, This is Antara, not Santara. Antara, which stand for DAMPA, depot medroxyprogesterone injection. You can see the dose is 150 milligram, and this Antara or DAMPA injection protect for 3 months. If they gave you net EN is norethistérone enantate. We give 200 milligram injection. Remember, DAMPA dose was 150 milligram given IM. Net EN is 200 milligram, and it protect for 2 months. Okay. If they gave you this Mala N or Mala D image, Mala N and Mala D both are normal dose OCP. In normal dose OCP, ethanyl estradiol is 30 microgram. Levonorgestrel is 150 microgram. Now, a microgram can be written as mcg, or it can also be written as 0.15 milligram. Now, this is Mala N. Mala N is free, but if it is Mala D, D for Dukan, shop, it is sold at 3 to 5 rupees per strip. Both Mala and Mala D are having the same composition, ethanyl estradiol 30 and levonorgestrel 0.15 milligram. But if it is a low dose OCP, which comes in market by the name of Femilon also, then ethanyl estradiol will be only 20 microgram, levonorgestrel will be same 0.15 milligram. Only one thing that differ is ethanyl estradiol become 20. And in Mala and Mala D, they can ask what is the dose of ferrous fumarate tablet. So the iron tablet, which is taken from, like if I am a female and this is the first day of my menses, and I suppose, so when will you start giving me OCP from? So the first OCP is given on 5th day of menses, because for 3-4 days I will have menses, and then on the 5th day I will take first tablet. I will take it for 21 days, and then there will be a gap on 7 days in which I will take ferrous fumarate tablet. This ferrous fumarate tablet dose will be 60 milligram, and in this 60 milligram tablet there will be 20 milligram elemental iron. So dose is 60, but iron is only 20 milligram in that low dose OCP tablet. In that low dose iron, which is in the normal dose OCP tablet, 7 day is this iron which we have to take after 21 day. Okay. So do remember this normal dose, low dose. One more thing they ask is, if you will use an I-pill or unwanted 72, what will be the dose of levonorgestrel in that? So do remember, in I-pill, the dose of levonorgestrel is 10 times more, 1.5 milligram. But there is other type of tablet of I-pill also, which has half dose, 0.75 milligram. It is taken in 72 hours, and second tablet in next 12 hours. Okay. So there are 2 tablets of levonorgestrel which we can take in the second type of format, but in the usual format which we take, levonorgestrel is 10 times more than OCP, 1.5. And you can see here Mala D also have the same composition, levonorgestrel, ethanyl estradiol and ferrous fumarate. Now this is Chaya. कैसे लोगे छाया को? How will you take Chaya? To take Chaya, the regime is twice a week for first 3 months and once a week after 3 months. पहले 3 महीने हफ्ते में 2 बार, फिर हफ्ते में 1 बार. Once a week after 3 months, twice a week in first 3 months. This centchromen, C stand for centchromen, C for Chaya. So very simple to remember. And do remember Chaya and one thing which we read above, Antara. These two, DAMPA है ना, depot medroxyprogesterone acetate, DAMPA is Antara, and Chaya. These two things are promoted in Mission Parivar Vikas. है ना, we promote Mission Parivar Vikas is family planning program of India, in which you can see the logo with many people holding hand है ना, on the palm. So in that Mission Parivar Vikas family planning, government is promoting Antara and Chaya, 2 things, centchromen and DAMPA injection. Now what is this? Is this second generation IUCD or third generation? See, third generation is hormonal, and to keep hormone we need plastic. There is no plastic, it is metal directly, so it means it is second generation IUCD. And this special IUCD is multi-load 375. It's not copper teeth 380 AG. If there are teeth, it is multi-load 375, and we all know IUCD, 2 questions they always ask again and again, is the best emergency contraceptive. Why it is best emergency contraceptive? Because it can be given up to 5 days of use. Second thing is that this IUCD, what is the mechanism of action, how it work? It is spermicidal is the main mechanism of action. It will kill the sperm. One more thing we should remember is that the most common side effect of IUCD is bleeding, but most common cause of removal is pain. So it's not so difficult to remember. PR is the way to remember. Pain for removal, bleeding is the most common side effect. And whenever we give IUCD, we took the infection of vagina upside, so more chance of pelvic inflammatory disease, more chance of ectopic pregnancy. Because in uterus you have IUCD, so now pregnancy can occur in the fallopian tube. This two thing is increased by IUCD, PID and ectopic, and when we will read OCP, we will read that OCP decreases PID, OCP decreases ectopic. Let's revise this advantage and contraindication of OCP being asked again and again. When they talk advantage, first is it reduce PID, reduce ectopic. Second is O for OCP increases outside cancer. So it increases the cancer of cervix, there where it is a contraindication, and it also increases cancer of breast, but it is a bit controversial nowadays. But cervix is definitely increased, and what is decreasing outside increases. O for OCP outside increases, but inside decreases. So it decreases endometrial cancer, that means uterine cancer, and it also decreases ovarian cancer. Okay. Third advantage is we can use is if the bleeding is too high and HB is less than 9, then we can give it in menorrhagia. It decreases PCOD also, where along with metformin we can sometimes use OCP as treatment. It decreases osteoporosis in postmenopausal women. But for this thing now we are using selective estrogen receptor modulator like tamoxifen. So these are the some advantages, mainly 6 things which you cannot dare to miss. Again and again ask 4, 5, 6. And do remember one advantage is that OCP, we have read 6 things you cannot miss. Similarly, contraindication, first CS cervix you cannot miss. Second, if there is history of DIC, what does a DIC stand for? It is disseminated intravascular coagulation. So if there is any history of DIC, we don't give it. Then if there is history of cardiovascular accident like heart attack or stroke, then we don't give it. Fourth contraindication of OCP is if there is hepatic adenoma, ask again and again, hepatic adenoma or deranged LFT, then we also don't give OCP. Deranged LFT, hepatic adenoma. Fifth is if there is classical migraine. Classical migraine is with aura. Aura means before the headache there will be blackening in front of the eye. So then we don't give it. And sixth is if there is congenital hyperlipidemia, then we don't give it. So these are the 6 contraindication, absolute contraindication, and 6 advantage. And mostly when they ask question, they ask only from these six things. Please don't forget this point. These are so important. Now, if you don't find any teeth, then this copper T is the copper T either 380 Ag or 200 Ag. And this 380 Ag, as you all know, protect for 10 years. If it is 200 Ag, it will protect for 4 to 5 years, just like multi-load 375 also protect for 4 to 5 years. So there are 4 examples of second generation IUCD. Nova T, which also look like this and also protect for 4-5 years. Multi-load 375, copper T 200 Ag and copper T 380 Ag. 4 are example of second generation IUCD. First generation IUCD was Lipley's loop, जो loop से निकल आता था. It has high expulsion rate, so we are not using it anymore. And this 380 is the area of copper T in millimeter square. Okay, so that's there. Now, if they gave you plastic in IUCD, that is third generation IUCD. And in third generation IUCD, we have Mirena and Progestasert. Mirena protect for, Park has written 7 to 10 years, but gynae people say 5 to 7 years. So let's take it 5 to 10 year protection is Mirena. Progestasert protect for 1 year only. So these are third generation IUCD, hormonal IUCD. that's why there is plastic and you can easily identify it. This was old family planning program logo. Now we don't use it. Now is Mission Parivar Vikas, which is there. This is of course female condom because it has 2 rings, and this female condom is made up of polyurethane. Female condom has higher failure rate than male condom, because if you are removing, I am a female suppose, and after sex I am removing my condom. Now if his sperm fall, I can become pregnant. But if I am removing a male condom, sperm will fall on the ground, and from a ground the child will not germinate. So male condom has lesser failure rate, female condom has higher failure rate. Female condom made of polyurethane, male condom made up of latex. This is image of Norplant, which is an intradermal implant. We insert it intradermally, and after that it will release 35 microgram progesterone per day. And this Norplant will protect the mother female for 4 to 5 years, once it is inserted. And this was the old logo. The new logo is this Mission Parivar Vikas, as I was saying, palm with multi-health, in which we promote what 2 things: Antara, which is Dampa injection, and Chaya, which is Centromen, which is taken twice a week for first 3 months, once a week in next 3 months. This is Mother Absolute Affection breastfeeding program of India. And in this Mother Absolute Affection or breastfeeding program, government is also opening some breast milk storage center, so that if mother is having HIV, even then the child can be getting mother milk. So breast milk storage center are also being opening under MA. This is Sankalak, not Kalank, Sankalak. Sankalak is the Hindi word which means compilation. So it is compilation of data, national AIDS data, compilation of national registry data from 2017 to 2020. So in this logo, if they just have this part, only this part, this will become NACO. But if they have a big tail, this is Sankalak, which is national registry data 17 to 20 compilation together. We are together putting it Sankalak. But if they made this purple color logo, not blue, purple color, then this will become for leprosy. If they make it pink color, if they make it pink, pink will be for breast cancer. Okay, and if they have this circle, this circle, blue color circle for diabetes awareness. So do remember this thing. Now, what is this? This is NTEP, National TB Elimination Program, in which target of India is that we will eliminate TB by 2025. Eliminate TB by 2025. World will, SDG, as I said, had discussed it to eliminate by 30. But India, we are more developed, so we will eliminate it 5 years early in 2025. Okay. Then next is in NTEP, if you are doing someone sputum smear and 2 sputum smear is negative, but X-ray suggestive of TB. On X-ray you can find TB. Then what will you do? Then you will do CBNAT, cartridge-based nucleic acid amplification test directly. And do remember, in 5 cases, CBNAT is done directly. Otherwise, for screening of population, if you want to know how many TB cases are there in your village, then you will do Jordan smear. But if you want to screen HIV patient, diabetes mellitus patient, COVID patient, previously treated TB cases, previously TB patient, or pediatric TB case, in these 5, we directly do CBNAT. We don't wait for Jordan smear report. So this has been also asked in HIV, what we directly do? CBNAT. Now this is Nick Chai. Nick Chai. Nick means no. Chai means loss of body. TB is loss of, known as Chai, because in TB there is loss of body. So this is no TB program in which there is what we do in Nick Chai. Nick Chai is follow up, and along with follow up, what they do? Follow up and reporting of TB patient. And this reporting of TB patient is not just by private, it is also by government with the same app, both by private and government, both hospitals. And we can do this reporting on email, WhatsApp also. This is Nischay. But if they say Nischay, Nischay is UPT kit for pregnancy. Okay. So you can see here, S come first. If S come first, S stand for sex, and sex will lead to pregnancy. So UP urine pregnancy kit is Nischay with S first, and Nischay is for TB. Nischay is UPT kit, which is distributed by ASHA. You can see the logo here. Nischay look like this, and this purple color flower is the logo. This is Nischay. Nischay means to be sure of, as I was saying. This is Nischay, UPT kit for ASHA. Poshan Abhiyan we have already discussed. Nutrition program target is 2% reduction of 2% reduction of malnutrition, stunting, and wasting. Anemia Mukt Bharat target is 3% reduction, and it has 6 into 6 into 6 strategy. कुल मिला के बड़ा ही छक्का प्रोग्राम है. What are the 6 into 6 into 6? First 6 are the people who will get the benefit, beneficiaries. Next 6 are the 6 intervention they will do, and last 6 are the 6 institutional mechanism. So BII, beneficiary, intervention, institutional mechanism. Now what are the intervention which they do in Anemia Mukt Bharat? First is of course IFA, second is albendazole, third is behavior change communication. We will say it to the mother that if they will eat, their child will come first, so they will eat it. We will say it to the child that if you will eat, you will be able to hit all the children of the street, so they will eat it. Therefore, by saying solid body, smart mind, we will change their behavior. This is behavior change communication, fourth benefit. Fifth is we will have digital HB measurement, and we will try to do the treatment. Fifth is we will try to put iron folic acid in the salt or other food item. And the sixth benefit is we will not only focus on nutrition related anemia, but also focus on malaria, fluorosis, and thalassemias, etc. So do remember the sixth benefit of Anemia Mukt Bharat program. Not benefit, intervention. 6 beneficiary, 6 intervention, and 6 institutional mechanism is very easy to remember. First thing, they will open National Anemia Mukt Bharat unit. And you can see National Anemia Mukt Bharat unit will be same as National Center of Excellence. So these two are same thing almost, 2 institutional mechanism. Then third they will do is interministerial coordination. And coordination will be same as convergence with another ministry. So these two are also same. Very easy to remember. Coordination, convergence, National Anemia Mukt Bharat unit, and Center of Excellence, two same thing. Now, only thing is that is different is one thing they will focus on this logistic chain, and the last is they will create digital portal dashboard for Anemia Mukt Bharat. They will create a dashboard in which all the data entry will be there, that which state has more anemia, where we need to focus and all. So dashboard and supply chain, these two are different. These are the 6 mechanism which we will do in Anemia Mukt Bharat. This is Kilkari, not Pichkari. Kilkari. Kilkari is the first cry of the child. And what is this? This is mobile recorded messages will be given to the mother. She will listen to that message, and by listening to that message, she will be able to take care of the child. So simple. So recorded messages on phone for to mother for child care. This is Kilkari. So simple. Pediatrician jao tel lagane. Just she will listen to the phone and she will take care of the child. That is Kilkari. Now, this is the logo of Bureau of Indian Standard, which you can see on silk sarees and gold jewelry. This Arogya Sukh Sampadam is logo of Ministry of Health Family Welfare. Ministry of Health Family Welfare also look over Food Safety Standard Authority of India, and it also have Ayushman Bharat under it. And remember this two things, FSSAI and Ayushman Bharat, they both are funded by state and central government. So state and central government, they have contributory role in these two programs. And MOHFW, of course, look over these two. In Ayushman Bharat, state government gave around 30 to 40% fund, and central government gave around 60 to 70% fund. So these are ruled by both. This is a very good logo of death and life. Remember first thing, that death and birth, where will you report it? You will report it at PHC. Within how many days you will report it? In 21 days you will report it. And this reporting of birth and death is under which reporting system? It is civil registration system under which we report it. Other than civil registration system, there is one more system, SRS, sample registration system, in which we cover record data twice. So that is dual data reporting. First, a field worker go and collect data, and after that, someone, an invigilator, go and record the data second time. Then they match it and then they publish the data every 6 months. So SRS give data on infant mortality rate and maternal mortality ratio. But this birth death data come from civil registration. And if you have to register marriage, for marriage in village, you will go to sub center. In city area, if you will register your love marriage, you have to go to the office of sub divisional magistrate, SDM office, where I went to register my love marriage also. So this is SRS. Now, if they are talking about National Family Health Survey and district level health survey, these two report data on immunization. Along with that, they also report data on breastfeeding, anemia, iodine deficiency, and domestic violence. But main thing they ask is immunization data, NFHS, DLHS. Do remember, census, which is done every 10 years, give us the data of sex ratio, but census do not give death data. No death data is reported by census. Okay. This, as we already discussed, is about diabetes awareness logo, blue color circle. This is the logo of ESI scheme. In ESI scheme, if someone is getting health checkup and health treatment, this checkup and treatment is not sickness benefit. Checkup and treatment is coming under medical benefit. And for this medical benefit, which they are getting, 0.75% of total monthly money come from the employee who are working. 3.25% come from the employer Malik, the owner will give 3.25. 1/8 will come from state government and 7/8 will come from central government. So who is the main funder of ESI scheme? Central government is the main funder. Second thing is, if they say sickness benefit, it is 91 days. But if they say extended sickness benefit, that is of 2 years, extended sickness benefit. But sometimes they can also ask enhanced sickness benefit. If they say enhanced sickness benefit, it is only for 7 days or 14 days. 7 days if I cut my wire, vasectomy, and 14 days if tubectomy occur. Okay, so enhanced is for 7 or 20 days, 7 or 14 days, extended is for 2 years. This is cessation, mobile cessation program. If you want to stop smoking cigarette, give a missed call on this number. Give a missed call right now. If you give a missed call on this number, they will start calling you again and again, till you quit. What? Mobile phone. And that's why it is cessation. Do you think it's so easy to quit smoking just by getting missed call? Of course, it's not so easy. But still, you can try on this number. And let me tell you, it's very easy to quit smoking. I have already quit smoking more than 54 times by now. It's very easy to quit smoking, not difficult. Just 5 days back, I quit smoking again. So it's very easy. Now, this is Mobile Academy. Mobile Academy, what is it? This is ASHA training on phone. She will listen to phone and she will get trained. Otherwise, usually if you see who give ASHA training is being given by Anganwadi worker and ANM. And for how long they give the training? 23-day training. But here they will just listen to phone and they will get trained. Do remember two more things written in PARK, that the minimum education is not 8th pass, minimum is not 10th pass, minimum is 8th pass is minimum education. It is written at 3 places in PARK. If you want, I can show you the picture from PARK textbook recent edition of PSM right now. 8th pass is minimum education, not 10th. Second is, there is 1 ASHA per 1000. Okay, and do remember that ASHA and Anganwadi, both of them do not do 3 work. They don't make malaria slide, because malaria slide is made by MPW health worker male. They don't conduct delivery. They help mother during delivery, but not the doctor, and they don't give vaccine. But they are still paid for vaccination because they are working as motivator, except they are not paid for, ASHA not paid for 3 vaccine. Which 3 vaccine not paid for? One is BCG, one is OPV 0 dose, not first dose, 0 dose, and other is hepatitis B, because these 3 vaccines are given at birth. So at birth, mother and mother-in-law will be in the hospital, so there is no one at home to motivate, hai na? Whom the ASHA will motivate, Sasurji, father, no, there is no one in house to motivate, and ASHA is not giving vaccine, but she is paid for all other vaccine because she is working as motivator, but not for these vaccines. So do remember, 3 are not work of ASHA. Malaria slide, delivery, vaccination, not work of ASHA, and she is not paid for these 3, but paid for all other vaccine. This logo where you can see a Holika holding Prahlad in the lab, like that. This is the logo of Anganwadi program. Do remember, Anganwadi program come under Integrated Child Development Scheme. If they gave you in exam a question that there is this 18-year-old girl who is malnourished and not going to school, which program will benefit her? So she is already malnourished, she needs food, and if she is not going to school, then school health program or midday meal or PM Poshan cannot help her. In that case, ICDS will help her. Okay, ICDS will help her, because if this question they ask like this, 18-year girl not going to school, which program will help her? Without writing malnutrition, if they ask, then answer will be Rashtriya Bal Swasthya Karyakram or Rashtriya Kishor Swasthya Karyakram. Because in Bal Swasthya Karyakram also till 18 year of age, Ayush doctor, Anganwadi and ASHA, they mix together and they do the screening. ASHA before 6 months, Anganwadi 6 months to 6 year, and Ayush doctor from 6 year till 18 year. And in RKSK, which is adolescent program, Rashtriya Kishor Swasthya Karyakram, till 10 to 19 year, there is adolescent friendly health clinic 1 day per week at PSC, 5 day per week at CHC, where we get treatment. So she can get treatment under RKSK and RBSK both. But if she is already diagnosed with malnutrition, there is no treatment, there is food. The treatment is the long-term food supply. So that's why if malnourished word is written, ICDS will help. If malnourished is not written, then RKSK, RBSK can help. Okay, this was the old logo of midday meal program, which is no more. Now we have PM Poshan. Health in your hand, आपका स्वास्थ्य आपके हाथ. क्या मतलब? They want to say don't smoke, don't drink, health is in your hand. And they have asked that in this program NPCDCS, which is not included. So 4 things are included: diabetes, heart disease, stroke, and cancer. 4 are included, rest are not included. Okay. Now this is the logo of India Newborn Action Program, under which we are improving the number of bed for better treatment of infant. There will be 1 bed at PHC. This is known as Newborn Care Corner, NBCC. Then there is 6 to 8 bed at CHC. We call it Newborn Stabilization Center. So after care we will stabilize. That's why it is Newborn Stabilization Center. And then there is 12 to 16 bed at district hospital, which is better than CHC. We call it Special Newborn Care Center. Special Newborn Care Center. So how to remember it? The way to remember it is, we all know first there is PSC, then CHC, then district hospital. 1-6-12. 1-6-12, PSC, CHC, district hospital. First we give care, then we stabilize, then we give special care. Okay? Care, stabilization, special care. So do remember which facility is not available at CHC. At CHC, neonatal resuscitation with help of ventilator and all, these are not available. There can be a pediatrician who can do the resuscitation, but there is no ventilator and all at CHC, so that cannot be done. Plus CHC, do remember, is the first referral center. It's not PHC or sub-center. CHC is first referral. Now, in urban area, urban sub-center don't exist. But urban CHC do exist, and they have asked this question in NEET exam that one urban CHC look over 5 urban PHC. One urban CHC is at 2.5 lakh population. One urban CHC is 30 bed, but if it is metropolitan city, it is 100 bed. And this question was that can we open urban CHC near district hospital or medical college? Answer is yes. It can be open near medical college or district hospital. The less serious patient will go to medical college, district hospital. More serious will go to less serious will go to urban PHC, more serious will go to medical college, district hospital. Okay, this is the logo of Cheer Ayu. Cheer Ayu means longevity. You can see children playing here. This is Rashtriya Bal Swasthya Karyakram, in which Ayush doctor, Anganwadi, ASHA mixed together, and they screen for 4D. What is this 4D? They can ask. First D is disease of childhood, बचपन की गलतियां नहीं, बीमारियां. Second D is deficiency disease. Third D is defect since birth, and like my case. And last, fourth is developmental anomaly, like autism and all, and developmental anomaly and defect. So these are the 4D for which Ayush doctor, ASHA, Anganwadi screen, but RBSK look for 30 disease, but it don't include zinc deficiency, and it also don't include congenital glaucoma, because for zinc deficiency we need blood test mainly, and in 90% patient there is no dryness which is appreciable, so we need blood test and all. And in congenital glaucoma we need instrument. Again, to measure optic nerve thickness we need instrument, or to measure eye pressure we need gonioscope and all. And Ayush doctor is going there without instruments, so zinc deficiency and congenital glaucoma do not come under it. Do remember this thing about zinc deficiency. Again and again they ask, if zinc deficiency question came, first thing it lead to decreased in sexual function, it can lead to hypogonadism, less sex can be there. That's why if you have loose motions and all, your sex time can decrease, because loose motion is representing that zinc is not getting absorbed. So this is one. Second thing which is being asked in NEET is there is dryness around nose and mouth, which can occur with zinc deficiency. Third thing is zinc deficiency also lead to poor wound healing, and our wound healing power become less. But if they talk about poor bleeding from gum, poor collagen synthesis, that is vitamin C. But all these 3 questions came from zinc, do remember it. Zinc is given for 14 days in case of diarrhea, and if age is less than 1 year, we give 10 milligram per day. If age is more than 1 year, we give 20 milligram per day. The role of zinc is zinc help in formation of cilia. What is the role of glucose in ORS? Glucose in ORS work as co-transporter. It work on GLP-1 receptor and help in co-transport of glucose. This logo is RKSK Kishore. Kishore means adolescent, 10 to 19 year. And government think adolescent are the one who play kite. Wahi peche ladate hain. They play kite and try to make knot together. So this is adolescent program RKSK, in which, as I was saying, there is adolescent friendly health clinic, 1 day per week at PHC and 5 days per week at CHC. Second thing in RKSK is adolescent reproductive and sexual health, in which group of female from the village, adolescent girl, they will hold monthly meeting with panchayat and school teacher. With panchayat they will raise demand, and when they will meet with school teacher, it is expected that school teacher will give them sex education about menstrual hygiene and safe disposal of sanitary pad and other sexual activity, of course. So these 2 things, AFHC and Earth, come under RKSK. This is Pradhan Mantri Surakshit Matritva Abhiyan. PMSMA. And this hand you can see in the logo is of the Prime Minister himself, and this Modi hand. In this PMSMA, what they are saying that bhaiyo or bahno, on which day you will go to government hospital, 9th of every month you will go to government hospital and you will get free investigation, free treatment, free medicines, of course, free screening, free blood test, everything will be free on that day. For whom? For pregnant mother under this program. But we have already read that in JSSK, Janani Sishu Suraksha Yojana, these things are free not only for pregnant mother but also for infant in every day of the month. So what the government is giving on 9th, Babaji ka thullu, they are not giving anything on 9th, it is free on any day of the month. So this is one thing in PMSMA. Second thing in PMSMA is that private obs-gynae doctor can go on 9 and they can go on 9 and they can give voluntary services at government hospital. Okay, so this is happening on 9. They are going with their visiting card, and the poor patient who are coming to government hospital, they are asking them to come to their private clinic. So on 9th of every month they can go to government hospital and can do voluntary checkup. Third thing under PMSMA is there is a logo that they have created, different color logo. Red is for high risk pregnancy, blue is for eclampsia and pre-eclampsia, pregnancy hypertension in pregnancy, eclampsia, pre-eclampsia. Then yellow is for yellow you cannot see. Yellow is for the pregnancies which are having comorbidity like diabetes mellitus or hypothyroidism or TB in pregnancy. Now, one more question has come for diabetes mellitus. At which week we should do the screening in mother? The ideal time is 24 to 28 week. 24 to 28 week is the second trimester we do the screening for gestational diabetes. But if they ask one answer, 28 week will be the best. And which type of test is done at sub-center? Random blood sugar test is done at sub-center at 28 week for diabetes mellitus in pregnancy. And in PMSMA, the last category is green. Green is for normal. So these are the three things under PMSMA. Do remember the classification: blue for hypertension and all, yellow for comorbidity. This is Rashtriya Swasthya Bima Yojana. This is insurance program under Congress government, lift kara de, in which there was total 30,000 rupees given, but it can increase to 1.5 lakh per year per BPL family. BPL family are those who are earning less than 7,000 per month. So then, of course, this program Ayushman Bharat came, under which there is Pradhan Mantri Jan Arogya Yojana, in which now government of India is giving 5 lakh insurance. This 5 lakh insurance is for economically weaker section family. Economically weaker section under this program are those who are earning less than 10,000 per month. And economically weaker section family, they will get this facility in both private and government hospital by using this card, because unfortunately even the government hospital is not free in India. So both places this card can work. One more thing is, in this Ayushman Bharat, one thing is PMJ, second thing is health and wellness center. Under health and wellness center, government is saying that we will improve and we will change sub-center and PHC. And when they will improve and change sub-center and PHC, they will give some benefit. What are the extra benefit they will give? The first extra benefit is they will give dental facility, then they will give mental facility, then they will give ENT, geriatric care facility, palliative care facility. This is not sometime even at medical college, but government said we will give it at sub-center PHC. And sixth most important they will give is yoga, kyunki yoga se hoga, and yoga will take care of the other thing. So 6 added benefit is given at sub-center PHC, now planning to give it. This is health and wellness center concept. The third thing which being asked in last MCI exam is that under Ayushman Bharat only, they also include now school health program. Why school health program is added under it? Because there is a health and wellness day which is going to be celebrated on every Tuesday. And on this health and wellness day on Tuesday, one male and one female student will be selected, not for doing couple yoga, but as health and wellness messenger. And they will also select teacher, student as messenger and teacher as health and wellness ambassador. And what they will do with the student, on every Tuesday they will motivate the student for yoga and meditation. So school health program, it also come under Ayushman Bharat. Plus school health program also come under PHC Vision Center, also look over it, because one work of PHC is for screening. And here in school health program, who does the screening? There is no doctor which go here. In a school health program, remember, doctor do not visit, teacher visit and screen children. The space for each children is 10 square feet, and the desk is not plus, it is minus desk which is there. For every one class there should be 40 student, one urinal at 60, and if you mix child and urinal it will become 40. So 40 at 100. 25% area should be door and window, and light should come from left side. So these are the school health program question which has been asked. This logo is of Niti Aayog. Niti Aayog full form has been asked in previous MCI exam. The full form is National Institution for Transforming India. For transforming India. So what this Niti Aayog does is it gives idea to the government, technical advices to government on increasing private partnership in government organizations. And they have asked that it replaced which organization. So Niti Aayog, which is National Institution for Transforming India, replaced National Planning Commission. See, National Planning Commission was there in India from 1950 till 2013 in Congress regime, and it has all corrupt people of Congress in it. So then in 2014, BJP came and it said, hey, all you corrupt people of Congress, go away. Now our corrupt people will work. And they replaced National Planning Commission with Niti Aayog. And so this is the replacement and full form which you have to remember. This logo is the logo of National Leprosy Eradication Program. And I was teaching it in one of the class. A student said that, sir, you can see in this logo there is both Congress and BJP. And so it's eradication program which is there for leprosy. Do remember, India has eliminated leprosy in 2005. And when we say eliminated, for elimination, we need less than one case per 10,000. Not per 1,000, per 10,000 for leprosy elimination. But if we are talking about neonatal tetanus or filariasis elimination, for these two elimination, the criteria is less than one case per 1,000. But for leprosy, it is less than one case per 10,000. Now, if you are founding new leprosy case, or you are founding, you want to know whether leprosy detection is occurring well or not, this percentage of new case with grade 2 disability, if you are finding people with grade 2 disability at the first time, it means ASHA is not searching for cases well. आप गांव में गए और आपको सबसे पहले 25% लेप्रेसी के वो केस आ गए रिपोर्टिंग में जो ऑलरेडी डिसेबल्ड हो चुके हैं. If you already finding disability 25% out of 100, it means the detection is not done early. So percentage of new case with grade 2 disability is the best indicator whether search program for leprosy is going well or not. Best indicator of leprosy detection program, whether leprosy detection is occurring or not. Okay. So if leprosy detection is occurring well, grade 2 disability will not come first. And leprosy detection program impact is not decided by multibacillary cases, because multibacillary cases are only those cases which have more than or equal to 6 lesions. So even if it is multibacillary or paucibacillary, it is not telling us whether detection is occurring well or not. Multibacillary is just a stage of disease. It is not telling about detection. Detection is best detected by percentage of new case with grade 2 disability. Okay. One more thing you should remember in leprosy is that there is 3 things which is sufficient to make the diagnosis: thickened nerve, loss of sensation, and depigmented patch. Even if Jaden smear is unable to be done, based on these three, we can make the diagnosis. And if there is a patient with lepra reaction, what is the drug of choice for lepra reaction? The drug of choice is methylprednisolone. And if someone develop lepra reaction, will we stop multibacillary therapy, MDT, for leprosy or not? We will not stop MDT, multibacillary therapy, multiple drug therapy of leprosy. Now, one question came in recent INICT is, in MDT of leprosy, which drug is causing darkening of skin? So, clofazimine. This is the drug which cause darkening of skin and opacification of lens. So if you found any of these two things, you can stop clofazimine. You need not to stop dapsone and rifampicin, but you can stop clofazimine. It can lead to darkening and all. Now this program which I left is Mission Indradhanush, because this program is no more. It was Mission Rainbow because it was for 7 diseases. Very easy to remember: DPT, then 3 which is given at birth, BCG, OPV, Hep B, and measles. But this program is no more. Now we have intensified Mission Indradhanush 5.0, which is for all the vaccine of national program. So Mission Indradhanush is no more. Okay, this is gone. Step surveillance, they ask again and again, what are the 3, which test is not done in step surveillance and which criteria is not included in step surveillance. So why we do step surveillance? If you want to know which country have more high risk population for NCD, whether India have more high risk population for BP and sugar, or Brazil have more high risk population for BP and sugar. If you want to know it, you will choose 5,000 people randomly from India, 5,000 randomly from Brazil. First, you will go and ask them about their psychological factor. Psychological factor can also be called as behavioral factor. Then you will ask them about their physical factor. And then you will ask them about their hormonal or biological factor. Okay. So, what are the psychological factors which can lead to high diabetes and hypertension? Psychological factor can be, let's say, diet, exercise, alcohol. These all factors are there. Which all factor can lead to this thing? Physical factor which can lead to BP, sugar. That is, one is BP itself, which can lead to hypertension. Second is the body mass index. Third is the age we can measure if it is more than 65. It's independent factor for high risk for hypertension and diabetes. And which hormonal factor we measure? In India, we only measure random blood sugar, but in US, UK, we also measure thyroid profile and lipid profile. Okay, so these are the tests done and these are the factor. The question they will ask is, which test is not included in step surveillance, or which factor is not included? So to remember the factors not included, answer will be usually therapeutic factor not included, because we are not doing step surveillance to start treatment. We are just doing it to know how many people out of 5,000 have high risk of diabetes or high risk of hypertension. So our purpose is not to start treatment. So therapeutic factor not included. This was NEET 2020 question. Factor not included, therapeutic. But what are the tests done? And so to remember the factor which are included, you can use the mnemonic bum pe haath. And there are 2 bum. So bum pe haath, BPH, 2 bum, dono pe haath. What is first B? First B is the behavioral factor. Second B is the biological factor. P, first P is the psychological, second P is the physical, and H stand for hormonal. So 2 bum pe haath, these are the factors. Now, what are the tests which is not done? They have asked it in last MCI also. To remember the test, one student suggested me this mnemonic BTR love to remember it better. First B stand for 2 things, BP and body mass index. T stand for thyroid profile. R for RBS, random blood sugar, which is done also at subcenter. And L stand for lipid profile. So BTR love. This is the way by which you can remember all the tests done: BP, BMI, thyroid profile, RBS, and lipid profile. Okay, I hope you will remember it. This is Beti Bachao Beti Padhao. It was an awareness program for preventing female feticide. You can see the logo on behind every truck. So Niti Aayog, we already discussed. National Institution for Transforming India. It replaced National Planning Commission. This image came once, that hydatid cyst disease, where you can find the adult form in SIP, in dog, in human. Do tell me, where will you find the adult form? Adult form means sexual stage. And first characteristic of adult is adult do sex. And wherever is the sexual stage or adult form, that is the main host. Okay. So who is the main host of hydatid cyst? Who is the main host of toxoplasmosis? And who is the main host of malaria? Because these are the three diseases in which human have asexual stage of the parasite. Asexual stage, if it will occur, then you will call human as facultative host or intermediate host. Facultative or intermediate. We are not the main host in three diseases. So which three diseases human are facultative host or intermediate host? Hydatid cyst, toxoplasmosis, malaria. And in these three, where are the adult form present? In hydatid cyst, adult form is in dog. Toxoplasmosis, it's cat. And malaria, it's mosquito. I cannot make the sound of mosquito, difficult. Okay, so these three diseases, human are facultative host, asexual stage occur. And they have asked, where does the asexual stage of malaria parasite occur? In RBC of human. Ring stage, Sijont stage, these are the name of asexual stage, vegetative stage. Okay, if they give you this life cycle, rat, urine, with animal, human and all, which life cycle they are talking about? Can you guess the life disease here? For this disease, they give doxycycline drug, and they also distributed zinc phosphide after Kerala flood. Because zinc phosphide is the one which is rodenticide, it will kill the rat. And here rat is causing that disease. Which disease they are talking about? They are talking about, yes, please guess the disease. I am waiting for your answer. Yes, Vikas, Lon Bilal, Abra Alam. Very good. Keep replying. And the answer is, this is the leptospirosis, which has rat, urine and human in it. And in leptospirosis, the drug of choice is doxycycline. But because leptospirosis was most common in Kerala flood, so after Kerala flood, they distribute zinc phosphide and not malathion. And it's wrongly written somewhere malathion. Malathion will kill mosquito, and malathion need to be resprayed after 3 months. So malathion is least toxic organophosphate for killing mosquito. Malathion is not used here, not used for leptospirosis. Not used for leptospirosis. For leptospirosis, we use zinc phosphide, which is a rat killer. Okay, so the answer is zinc phosphide. Very good. Which life cycle is this? You can see a pig here, which is the amplifying host. So that means it is talking about Japanese encephalitis. Remember, in Japanese encephalitis, man is the dead-end host. Maintenance host is heroine. But they can also ask, who is the reservoir? Can you tell me the reservoir of JE? Reservoir is same as maintenance host, because they are storing the virus in non-rainy season. So that's why they are reservoir or maintenance host. It is heroine or ardid bird. Same answer will be there. For both maintenance host, reservoir, answer is ardid bird. So in the story, Interculex, our nuisance mosquito, because it breed in dirty water. And this Culex is so talented कि ये उड़ती चिड़ैया के बम में काट लेता है. It bite in the bum of flying bird, ardid bird. Then it bite in the bum of Suarva pig and transmit it the JE through trans-ovarian transmission. And then it transmit human, and human cannot transmit JE just by mosquito bite. If I am bitten by mosquito and then the mosquito bite, suppose my friend Nikhil over here, then it's not that JE will be transmitted from me to Nikhil. It's not transmitted from person to person by mosquito bite. That's why we are dead in host. And the transmission is transovarian. Now they can ask this question again and again about the route by which we give JE. So JE and MR both are given subcutaneously. Both are given 0.5 ml. Where will you give JE? In left arm. Where will you give MR? In right arm. M for MR, M for mother love. Mother love is always right, so right side is MR. Okay. Similarly, they ask the diluent for MR. The diluent also you can remember by the same mnemonic. Diluent is sterile water. Just like mother love is sterile, so diluent is also sterile. And our right arm is MR. And in JE, we are using the live virus strain SA1414 bar, 1414 2 times. 1414-2 is the strain of live virus of JE which we are giving. And JE can be given up to 15-year maximum. We can give JE. Okay. So some questions which come. Other than this, the diluent of BCG is normal saline, because it is given at birth. So as soon as a child is born, we want to make the life of child a bit salty. बच्चे की जिंदगी नमकीन बनाना चाहते हैं, so we give normal saline as birth. And for JE, the diluent is phosphate buffer solution. Very easy to remember. If you write the full form of JE, it is Japanese. So Japanese, J and P both are coming. JE phosphate buffer solution. So 3 diluent and the site you should remember. Now let's do some question which being asked already in FMGE exam. If they say orthotoluidine test, or if they say orthotoluidine arsenite test, arsenite, both of them, what do they measure? Do they measure free and combined both, or free or chlorine demand or combined chlorine? They will detect free and combined both. Whether it's orthotoluidine or orthotoluidine arsenite test, both tests detect both free and combined chlorine. The difference is orthotoluidine detected together, orthotoluidine arsenite detected separately. And orthotoluidine arsenite is not affected by nitrite and other impurity, so it is better test. Chlorine demand is detected by Horrocks apparatus. Horrocks apparatus detect. This question has came in MCI exam that which device detect amount of bleaching powder needed to be poured in water to kill all bacteria. Amount of bleaching water for killing bacteria is detected by which apparatus? Horrocks apparatus. And in Horrocks apparatus, which reagent is used? The reagent which we use is starch iodine, blue color reagent, starch iodine, and 6 white tubes will be there. So they can give an image based question also. 6 white tubes, blue color indicator, that will be Horrocks apparatus for chlorine demand. Okay. Amount of bleaching powder to kill bacteria. And in the bleaching powder, which is the most important ion which kill most of the bacteria? So most important ion they ask again and again is HOCl minus, hypochlorous ion, which kill 80 to 85% bacteria. Hypochlorous, it has many rus juice in it, so it is killing maximum bacteria. Hypochlorous ion. Okay. And this is the cutting from which I discussed that orthotoluidine, orthotoluidine arsenite both detect both things. And this being Park textbook also, they both detect both free and combined chlorine. Now, low stationary phase of demographic cycle. Again and again, question come from demographic cycle, so do revise it before going to the exam. First phase is high stationary, fourth phase is low stationary, and 1 and 4 both have 0 growth rate because they are stationary. In high stationary, both things are high. In low stationary, both things are low. So they can ask this question, in which 2 phases birth rate is high? So phase 1 and 2 both birth rate is high. Birth rate high in phase 1 and 2. Let me show you this thing from this part, from the thing. You can see first stage high, second stage is early expanding. Both has high birth rate. In high stationary, both things are high. In low stationary, both things are low. So you just have to focus on second and third stage. In second stage, early expanding, birth rate high, death rate start decreasing. In third, late expanding, birth rate also start decreasing, and death rate of course will decrease further. And India is in this phase of late expanding. Fourth is low stationary, and declining will have more death rate than birth rate. So declining will have negative growth rate. Okay, do remember this demographic cycle, very frequently asked. Okay. So after this, they can ask the question of demographic bonus or demographic burden. Demographic bonus is when there is, bonus is a good news. So we need to decrease the dependent people when we decrease dependency ratio. And how can we decrease dependency ratio? By decreasing fertility rate. If we produce less children, then dependent population of less than 15 will be less and dependency ratio will decrease. And see, this dependency ratio, I hope you all know, it means population with age less than 15 year plus population with age more than 65, they are dependent on people between 16 to 64 year. So if you want to decrease the dependency ratio, we have to decrease the fertility rate. And that will be a good news for the country. That will be a bonus. Sometimes bonus is also known as dividend. So if they ask demographic dividend or bonus, it is by decreasing both dependency ratio and fertility rate. But if they ask demographic burden, burden is a bad news. We will be under burden if we have more people dependent on us. So burden is if dependency ratio increases. And how will you increase dependency ratio? By increasing fertility rate. Okay. So if both increases, dependency ratio and fertility rate, we get burden. And if both decreases, we get bonus or dividend. Okay. Bonus, dividend if both decreases, and burden if both increases. Okay. Anushka Patel want me to revise STD kit. Why not? And so let's discuss the STD kit. Of course, in STD kit, kit 1 is gray. And gray is most common color of the people also. They are not white or black and commonly given also. For cervical discharge, or if they say cervical erosion, this question has come. Female come with cervical erosion and vaginal discharge. Under which category it will go? So vaginal discharge should go in green category. But even if the infection is in cervix, discharge will come from vagina only. So main thing they have written is female with cervical erosion. So problem was cervical erosion, so we will give gray kit there. If cervical erosion or cervicitis, they say cervical erosion is written in PARC is same as cervicitis. So cervicitis or cervical erosion, gray. Second, very commonly asked is urethral discharge. That is also gray. And third, if they gave anorectal discharge, that is also gray. Okay. Then green is for vaginal discharge. After this, you can remember the other three category by the simple mnemonic WBR, just like white blood cell. It is white, blue, red. All are for genital ulcer. When we talk about white, it is bacterial genital ulcer, which is treated by penicillin. But many people are allergic to penicillin, so then we cannot give white, we give penicillin, we will give doxycycline. So both doxycycline and penicillin is for bacterial genital ulcer, which we are going to give. Then this R is for red, and red will for viral genital ulcer, that is herpes, and for herpes we treat acyclovir. So this is WBR after gray and green. Then the sixth, which is the most commonly given category, is yellow, because most commonly female come with discharge for very long time, and they will come with complaint of lower backache or lower inguinal pain. So why lower backache or lower inguinal pain occur in PID? Because infection of PID go and reside in pouch of Douglas, which is most retroperitoneal structure. Then the pain radiate to back and radiate to front part also. So in exam they ask again and again, lower backache, lower inguinal pain, which category? Yellow. Last is black, because mostly white color people make this classification, and somehow they are racist, so they put black is the lowermost. In triage also, STD also, they are putting it, not everyone is racist there, but like that you can remember, black is the least category in both triage and STD, and black is for inguinal bubbo. Bubbos means lymph node swelling, and most commonly they give is Chlamytobacter is the one of the reason for that. Of course chlamydia can also cause it, but Chlamytobacter is most common causing that inguinal lymph node swelling. So these are the 7 kit. Do you remember them? They ask again and again. Next question. Which male health worker goes house to house and make malaria slide? That is MPW male or health worker male, and this is active surveillance when we go and search for case. Passive is for notified cases coming to hospital themselves. And sentinel surveillance is for all case. If you mix active and passive, it becomes sentinel. So sentinel will detect all, passive coming to hospital, active when we are going and searching, like in malaria. Okay, now, and do remember, thin slide detect species, thick slide detect presence of Plasmodium. Two vaccines are there, MR and pentavalent. Which vial will be discarded in the next? So, not discarded means they are the one which follow open vial policy. Because in open vial policy, there are some vaccine which can be stored up to 4 weeks. If stored adequately between 2 to 8 degrees Celsius, we can use some vaccine up to 4 weeks. What are those vaccines which follow open vial policy or not discarded? Very simple to remember. Hep B, PCV, all tetanus, all polio. Say it with me and you will remember. Hep B, PCV, all tetanus, all polio. These are the vaccines which follow open vial policy. Some teachers also teach rotavirus, but rotavirus has not written in PARC, so I'm not writing it. So do remember 4 vaccines which follow open vial policy. All tetanus means, of course, DT, TT, DPT, and pentavalent all. Okay. And all polio, of course, it's FIPV and OPV. And FIPV is fractioned IPV, not fucked IPVs. So, which will be discarded? Not discarded is pentavalent. And which will be discarded? MR will be discarded. Okay. Chalo, very good. Do let me know if there is any doubt, any question. Be like Anushka Patel and let me know your doubt also if there is anything. So MR will be discarded. Very important question. Now, this question came in MCI first, then they repeated in INICT. So, which vaccine follow open vial policy out of them? Pentavalent, just like that you can answer PCV, Hep B, all tetanus, all polio. They follow open vial policy. A worker working in cardboard factory will develop bagasosis. Bagasosis also occur in sugarcane meal worker. And they can ask the causative organism of bagasosis, that is thermoactinomycetes saccharide. Thermoactinomycetes saccharide. Okay, then they can ask the causative organism of farmer lung, which is Micropolyspora faini. Bicyanosis occur in textile factory worker, and asbestosis of course occur in asbestos factory worker. There will be a special type of cancer, mesothelioma cancer of lung pleura. So if they gave you this question, clinical question, that patient have opacification in the peripheral lung field. Peripheral lung field is the pleural area. And he is working in asbestos factory. What is the answer? Asbestosis. Okay. Silicosis is most common respiratory occupational disease, and every silicosis patient should be annually screened for TB. Okay. These are the questions which they ask from here. Recent transmission of malaria, if they want, then we use infant parasite rate. Because if infant blood sample has parasite, it means malaria was transmitted in last 1 year. API tells us I for impact of malaria control program, whether malaria control program is working good or not, that is told by API. And if API is more than or equal to 1 per 1000, it means that area belong to intensive control phase. We need to spray insecticide in those areas. So very commonly they ask, even if 1 case occur in 1000 people, state is intensive control. Spin rate tell about the endemicity. If more malaria is commonly present in an area, then in this children, many children will have big spleen. So endemicity of malaria is told by spleen rate. And whether people are working or not, that is detected by annual blood examination rate. It is the best indicator of operational efficiency. Whether people are working or not is detected by ABER, whether slide are being made or not, ABER. And now whether malaria decreased from last year, and if last year API was 5, this year 1, that is API. This is telling impact. Malaria decreased or not. And now whether they are making slide or not, ABER. Recently transmitted or not, infant parasite. And whether malaria is commonly present in that area or not, by spleen rate. So these 4 indicators do remember and revise. Now, if they give histidine-rich protein kit, this histidine-rich protein kit detect histidine, falciparum, vivax or both. It detect only Plasmodium falciparum, not vivax. Lactate dehydrogenase kit, which is optimal kit, detect both falciparum and vivax. Okay, so these are the indicator which is there written here. Incineration is for yellow. We all know that. In yellow, there are 6 things which we throw. Cytotoxic, and let's say I go out after taking class and then I had a road traffic accident in which my leg are crushed. So you will cut my leg, throw it under yellow. Then the blood will come out. You will collect that and throw it in yellow, also liquid waste. Then the bedsit will be soiled and also all the cotton, all the bedsit, they will be thrown under yellow. Then you will take my blood sample to some micro lab, microbiological waste also goes in yellow. You will use some medicine and whatever medicine is expired or discarded goes in yellow. Last is cytotoxic drug, whose best method of disposal is collect and send back to manufacturer. If you are unable to send it back to manufacturer, then we can do inertization. Inertization means we will mix the waste, mix this pathological waste with 15% cement and 15% lime. If you mix it with cement and lime, now it cannot contaminate soil or water and it can be disposed easily. So that is the second best method of disposal of cytotoxic drug. First is yellow, and yellow goes by incineration. Do remember, if they say broken vaccine vial is not cytotoxic. So broken vaccine vial will go in, not in yellow, but in blue. But if they gave broken cytotoxic vial, then it will go in yellow. Vaccine vial, blue. If they gave culture medium or culture plate, medium or plate, both will go in yellow. It is written in park. Plate also, all the microbiological thing will go in yellow. Now, they can ask about plastic wrapper of syringe. Plastic wrapper of syringe, can you tell me which category will you throw plastic wrapper of syringe? I am waiting for your reply. Plastic wrapper, where will it go? And if you want to ask about any other thing, feel free to ask. Now, the average number of children that would be born to women over her reproductive lifespan. What is the answer? First, let me reply the earlier one. Plastic wrapper of syringe, answer will be black, because it is without any blood or infection. So all the garbage will go in black. It will go in black. Now, this average number of death born to number of children born to one woman. Total child, one woman, if they ask total fertility rate. But if they ask total live birth, which was the question in last exam, total live birth per 1,000 female. If they use 1,000, it becomes GFR. If they say one female, it's TFR. And GRR and NRR will only be the answer if they use the word girl child in the question. GRR means girl live birth per female between, of course, 15 to 49 years. And NRR is girl child minus those who died, considering mortality rate. Considering mortality rate per female. So do remember this simple way of answering this question. This is a very confusing part, but if you will focus, you can remember it forever. If they use the word girl, answer will be gross or net. Only two things can be the answer if girl word is given in the question. If girl is not given, then TFR or GFR will be the answer. If they use the word 1,000, answer become GFR. If they remove the 1,000, it becomes TFR, like in this question. In the girl, if they also use the word mortality, then answer become NRR. And if NRR is equal to 1, then we mean 2 child per couple. And for producing 2 child per couple, we need couple protection rate equal to 60%. Okay. So do remember these 4 terms. Very easy to answer. Girl child, GRR, NRR, mortality, NRR. Okay. Now, if they give needle, it will go in white. If they give needle with fixed syringe, that will also go in white. If they give scalpel, that will also goes in white. So all kind of needle, scalpel, blade, four thing go in white. Needle, scalpel, blade, and needle with fixed syringe. Four thing go in white. Okay. Chalo. Now, one question, Dheeraj Kumar is, Dr. Vikas is saying, explain this four term with the example of that forest cup you gave. Okay. So let's say there are some 100 couple who went into forest. They are young couple in reproductive age group. They went to forest. Why? To have wild sex. Yeah, they can do it. Jungle mein mangal karne ke liye, we send 100 couple to forest for 3 years. So they will produce some children. Let's say they produced 52 boys and 51 girls in next 2 years. So these are the live birth. And out of these boys and girl, one boy and one girl, they were playing together and lion came and eat them together. They died. So finally we have 51 boy and 50 girl. These are the two deaths which occur. They died before becoming adult, before 15 years. So if they ask general fertility rate, it is how many total live birth per female. How many is the total live birth? You can count it. 52, 51. How many? 103 is the live birth. And how many female are there? Don't say 51. 51 are child, girl child. They are not between 15 to 49. So these 100 couple are there. And usually in one couple there is one female. So how many female? 100 female. And if you multiply it by 1000, it becomes GFR. So this is the GFR. If they ask TFR, TFR will be same as GFR. Only difference is you will not use the word 1000. Remove 1000. Live birth per female will be TFR. Gross reproduction rate is girl live birth per female. How many girl live birth? 51. And how many female? 100 female. So girl live birth per female, that is GRR, 51 by 100. So it will come around 0.5. So, and if you see the TFR, it is coming around 1. So we can get it from here that gross reproduction rate is half of TFR. Because girl child is half of total child. So GRR is half of TFR. Finally, if they ask net reproduction rate, in net reproduction rate, we will subtract those girl child who died after birth. So there were 51 born, but 1 died, divided by total female 100. So it will come exact 0.5. This is NRR. Okay. So these are the four things which we use. And remember, if NRR is 1, then it means there is one child, girl child surviving per couple. And if there is one girl child, then X and Y chromosome are 50-50%. We can also have one boy child per couple. Then we say 2 child per couple. And so these are the 4 terms. I hope you will remember. And remember this formula also. Do remember NRR 1 is what we want, 2 child per couple. And what is the target TFR of India? Target TFR of India is 2.1. That means our target is that every female should produce 2 and 0.1 children. How come 0.1? Because out of that 2.1, some will die. So finally, it will come 2 child per couple. That's the target TFR. And India has achieved this target TFR of 2.1. Population growth is no more a problem for India. And this all thing has been written here. A pregnant lady suffered a scratch from a rabid dog after a rabid dog bite. What should be the next step? So if there is a scratch, scratch without bleeding they should have right, or scratch with bleeding they right usually. So usually if they say scratch with bleeding, it's category 3. But if they say scratch without bleeding, it's category 2. And as you all know, in category 2 we only give rabies vaccine. But in category 3, along with giving rabies vaccine, we also give rabies immunoglobulin plus rabies vaccine. And rabies immunoglobulin is something, dose they ask, we usually give human immunoglobulin and the dose is 20 international unit per kg. Half dose is given around wound and half dose is given IM. But if there is no chance of giving, let's say the dog came and bite on my fingers and not on my bum. If it bite on bum, you can give half around it, half around IM. But if bite on finger, you cannot give half dose around my finger. So you will give full dose IM. Remember the dose 20 international unit. And in category 3, it's a scratch with bleeding, plus it is bat bite, chamgadad bite. Let's say a dog came and lapa lap, it gives you a smooch and a licking on mucosa. That is also category 3. And if there is a scratch on face, that is also category 3. So category 3 is any bleeding, bat bite, licking on mucosa, a scratch on face, and we give rabies immunoglobulin plus rabies vaccine. Category 2, only rabies vaccine, is scratch without bleeding. And if there is only licking or nibbling means thoda sa noch ke gaya na, small like this, na? No bleeding, anything, just nibbling. So this is category 1 where we only wash. Now in this case, they have written that already a dog bite has happened. So if dog bite has happened and she is already vaccinated, then we need not to give immunoglobulin this time. We will give vaccination and local treatment of wound. But in the previous time, if she is not being vaccinated for bite, then she will get both immunoglobulin and local thing and vaccine. This will be the answer if previous bite and vaccination has not occurred. Do remember these two things. If someone is already vaccinated and after vaccination second bite occur, in that case the 2 doses which are given is on day 0 and 3. This is post-vaccination second bite. But if they say pre-vaccination, let's say in veterinary doctor, one work is the reproduction of dog. And if let's say any dog do not like the couple whom they will bite, and the veterinary doctor itself next time bring better one. So if there is pre-vaccination bite, you want to be protect yourself before vaccination, then we take it on 0, 7, 21 or 28. And if it is post-vaccination, only on day 0, 3. And the dose you already remember, okay? Now this is component bar chart, which is one above another. If it is one behind another, it is multiple bar chart like here, one then another, multiple bar chart. If they ask that we want to show the health system failure or health system not functioning well, failure or functioning, which diagram we will use? So this is a new diagram which we teach about Ishikawa or fishbone diagram. This can tell about this failure thing better, like this way we can tell it. Like what are the various factors which cause to health system failure? Like less doctor in rural area, only less GDP on health, and all those factors will contribute. This is Ishikawa fishbone diagram, which is also for qualitative data representation. Which is the complication seen in mumps. Mumps will have epididymo-orchitis as complication. Tetanus infection or ovary infection, testis or ovary infection. Otitis media is most common complication of measles. Measles have otitis media most common. Least common is subacute sclerosing panencephalitis for measles. Okay. Second is pneumonia, second complication of measles. This image they give and people think it is mumps. No, it is bull's neck of diphtheria. So this is diphtheria bull's neck. And in case of diphtheria, there is also, of course, pseudomembrane. Both of them will occur in diphtheria. If it is mumps, the swelling will be on one side. In diphtheria, the swelling will be here. Okay. Do I have bull's neck? It's double, triple chin, not bull's neck. And I was telling it in one of the class, students said, "Sir, you don't have neck." I said, "I guthi samjha gaya couple sarma. See, I have neck." But the swelling here, that is diphtheria. Swelling on this side, that will be mumps. Similarly, if rashes are coming out, that is chicken pox. Rashes are in the surface with cough, cold, coryza, measles. Okay. Survey of city, they have done ABCD. Fertility rate was 2.1, 2.46. Which city has achieved desired goal? Desired goal is 2.1. So city A has achieved it. Okay. We have already discussed it. Worker responsible for active malaria surveillance is MPW or health worker male. They do active malaria surveillance. ASHA, do remember, visit home of mother before and after delivery. And in a village, they have created this question in NEET, that in a village, mothers are not being allowed to eat papaya, mango, leading to vitamin A deficiency. Who will go to their house, screen them and refer them? Answer is ASHA. Will go to the house, will treat or refer them. So this is ASHA. Most cost-effective screening for cervical cancer, if they ask. If they use the word cost-effective, then answer is visual inspection by acetic acid, VIA. Because best screening is pap smear, definitely. But most cost-effective is cervical cancer, because it is written in PARC. You can see that pap smear screening requires excessive resources, and alternative method that can be more cost-effective is visual inspection by acetic acid, 5% acetic acid. So more cost-effective, clearly written in PARC, is visual inspection by acetic acid. Under Ayushman Bharat, we give 5 lakh, that is Pradhan Mantri Jan Arogya Yojana. We have already discussed, that's why there is 5 leaf, 5 lakh, and that's there. Most common cancer in head and neck region, if they ask, in India, of course, answer will be oral cavity. Now, let's discuss this part separately. If they ask, most common cancer of male, right, let's do it together, all the most common cancer. Most common cancer of world, what will be your answer? Lung cancer or breast cancer? Answer is breast cancer, because breast cancer people survive for 10, 15, 20 years. So at any time when we measure the burden, breast cancer will be more than lung cancer. And the formula for this is prevalence is equal to incidence into duration. So maybe lung cancer new cases are more, but breast cancer survive longer time. Therefore, at any time their burden is very high. So most common cancer of world is not lung cancer, breast cancer. Now, most common cancer of male of India, if they ask, that is oral cavity cancer. ऊंचे लोग ऊंची पसंद मानिक चंद, बोलो तो बोलो जवा केसरी, है ना, मुंह में रजनीगंधा, कदमों में दुनिया, है ना. This is oral cavity cancer, most common in male of India due to tobacco chewing. And they have asked, how will you do the screening? 2 उंगली डाल देंगे. कहाँ? We will do by finger manual inspection, one inside the mouth, one outside. If it is smooth, it is cyst. If it is rough, it is cancerous. That is for male of India, most common cancer. If they ask female of India, most common cancer, is it breast or cervical cancer? Again, the answer will be breast cancer, because cervical cancer will not survive for longer time. Duration of disease will be less. But breast cancer survive longer. So most common cancer in female of India also they ask breast. But if they ask most common cancer in female in lower genital tract will always be cervical cancer. But in general, if they ask female of India, most common cancer, breast cancer. Most common cancer of male of world will definitely be lung cancer. And most common cancer of female of world, if they ask, then it will be again breast cancer. So whenever they ask female most common cancer, world or India, breast. Most common cancer of world, combined male, female both, answer is again breast. And all this say is, all this thing we have already written here in this thing, do remember it. And this is directly from PARC textbook. You can see this table where they have written it, that when they talk about both sexes, most common cancer is breast, not lung. When they talk about female of India, most common cancer is again breast. So breast is the most common cancer of world, most common cancer in female of India. Both time breast is above. Okay. Chalo. Now, this is all the table. School health is responsibility of PHC Vision Center. And as I discussed, school health is also responsibility of Ayushman Bharat program. Okay. Ayushman Bharat also have Health and Wellness Center, PMJ, and Health and Wellness program is there in school. That's why school health program come under it. We have discussed it. And last thing is all the primary principle of primary healthcare except appropriate technology is a pillar, community participation is a pillar, intersectoral coordination is a pillar, except they have asked So the correct answer is universal health coverage, not a pillar. Do remember this 4 pillar, and it is appropriate technology, not adequate technology. Example of appropriate technology is WHO, ORS, and Sakir tape. Now they have asked in recent NEET exam, what do you mean by community participation? It means that involving community in planning and implementation, both. You will not give your idea for betterment of village. You will take villager idea and help them in implementing it. So planning and implementation both by the people of village, by the community, that is community participation. Do remember equitable and intersectoral coordination are the other 2 pillars. Now, patient presented with liver cancer working in grain groundnut, that is, they are talking about aflatoxin. We have already discussed the adulteration. They ask again and again. This is the green color fungus. The green color fungus is the responsible thing for releasing aflatoxin, Aspergillus flavus fungus. Now, Claviceps purpurea release the ergotoxin, which is black color ergot on wheat and rye. If they give this child image, protruded abdomen, is it only energy or carbohydrate, only protein, both protein and energy, or vitamin? What is the answer? A, B, C, D. Give me the answer for this. The answer is definitely only protein. If it is both, both become marasmus. Only protein is Kawasiorkar. Now, Dr. Janvi is there online and she is saying that, sir, it's my 3rd attempt, feeling a lot anxious, don't know what to do, kuch yaad nahi aa raha. Thank you, Janvi, for sharing your doubt and issue. पहली बात तो ये है कि saying this कुछ याद नहीं आ रहा, I am not able to remember anything is a wrong thing. You are missing 10%, 15%, not 100%. And this is natural thing that under exam pressure, we feel that we are forgetting. But what we forget is only 10-15%, not 100%. So don't say we are unable to forget everything. Say I am unable to remember the classification of cancer, say classification of drug, staging of cancer. Those part I am forgetting, you can say. You cannot say I am forgetting everything. But when you are saying I am forgetting everything, it means the anxiety is high. And to remove this type of anxiety, there is 2-3 things you can do. First thing you can do is just do some PYQs. When you will practice PYQ, you will find that you are able to do 6 or 7 out of 10 easily. Let's say you are able to do 5, 6 or 7 out of 10. That means you are remembering 70-80% only, then you are able to do PYQ. Whenever we do PYQ, as I said, our mind has this defective setting that when it sees the option, it start finding answer and it will give the correct answer. In the last day, don't revise theory if you are feeling anxiety, do PYQ. Doing PYQ will make you realize that I am able to answer when it come by option. जानवी, आपके साथ क्या हो रहा है कि आप थ्योरी की बुक उठा रहे हो और उस टाइम आपको घबराहट हो जा रही है और आपको लग रहा है मुझे कुछ याद नहीं है. लेकिन आप ही एक बात बताओ जानवी, जब सेम क्वेश्चन आपको हम ऑप्शन बना के देंगे तो आप ऑप्शन में तो टिक कर दोगे ना, है ना? इन द सेम थिंग विच यू आर अनेबल टू रिवाइज इन थ्योरी, आई एम श्योर यू विल बी एबल टू डू इन ऑप्शन सेटिंग. और एग्जाम में हमें पूरी थ्योरी याद होने की जरूरत नहीं है. एग्जाम में जरूरत है कि हम उन 4 ऑप्शन में से रूल आउट करें. तो अगर आपको थ्योरी नहीं भी याद आ रही है, आप ऑप्शन में से रूल आउट कर दोगे. प्लीज 3 बातें ना करें. एक तो ये ना कहें कि सब भूल गए हैं, क्योंकि सब कोई नहीं भूल सकता है. हम जो भूलते हैं वो 10% 15% होता है. तो ये बोलो कि इस एरिया में ये चीज भूल रही हूं. ये मत बोलो कि सब भूल गए हैं, क्योंकि वो हो ही नहीं सकता है. It is not possible that we will forget everything. We will only forget selective part in selective area. So say that only. First thing. Second thing, when you are in anxiety, do PYQ. By doing PYQ, you will realize that I am doing it correct when options are being asked. Okay? Don't read theory in the last day. It can create anxiety, but doing PYQ will relax you. Third thing you can do is you just take some deep breath and realize the amount of hard work which you already have done. You will realize that I have studied for this many time, and when you will do PYQ, you will be able to do that PYQ. So when we take deep breath, focus on the air going through nose into your lung capacity and then coming out. It's a very good way to relax in any situation. Even under exam pressure, you can do that breath focus and you can relax and come back to the study. देखो लास्ट डे में ऐसा लगना कि मैं भूल रहा हूं, ये नॉर्मल है, लेकिन ये बात सच नहीं है. आप लोग पहले तो खुद पे भरोसा करें. अपने 6 महीने या 4 महीने या 1 साल जो भी आपने अभी पढ़ा है और फिर आपने एमबीबीएस में पढ़ा था, वो सब आपके दिमाग में रखा हुआ है. आप जितना अपने दिमाग पे भरोसा रखेंगे, वो उतना ही प्रेशर में भी उस आंसर को निकाल पाएगा. अगर आप अपने दिमाग को निगेटिव बात बताएंगे तो वो डर जाता है, लेकिन डरा हुआ दिमाग भी जब ऑप्शन आता है तो बना लेता है क्वेश्चन. तो इस तरह से निगेटिव बातें ना बोलें, बल्कि पॉजिटिव बोलें अपने आप को कि मैं थोड़ी एंजाइटी में हूं, 10-15% भूल रही हूं, जब ऑप्शन मुझे मिलेंगे तो मैं बना लूंगी. जानवी, आप मुझे एक बात बताओ, क्या आप पीवाईक्यू बना पा रहे हो कि नहीं अभी, ये बताओ मुझे केवल. आर यू एबल टू सॉल्व पीवाईक्यू राइट नाउ 6 out of 10 or not? Just let me know that. And you will realize that you will be able to do the PYQs even under anxiety time. So an exam asks only PYQ. So you can do PYQ under that exam pressure. First thing. Second thing, कि एंजाइटी को रोकने की जरूरत नहीं है. थोड़ी बहुत एंजाइटी होने दो, वो होती है. एंजाइटी आपको अलर्ट रखती है, वो गलत बात नहीं है. एंजाइटी को हटाने की कोशिश करोगे, ब्लू नहीं सोचना है, ब्लू नहीं सोचना है, तो हम क्या सोचेंगे, ब्लू ही तो सोचेंगे. तो तरीका ये नहीं है कि आप एंजाइटी हटाने की कोशिश करो. तरीका ये है कि आप गलत, गड़बड़ क्या होगा उसकी जगह आप ये सोचो कि अच्छा क्या क्या होगा. सोचो कि आप पार्टी कहां कहां किसके किसके साथ करोगे एग्जाम के बाद, और देखोगे आपकी एंजाइटी की जगह वो अच्छे थॉट आ रहे हैं, है ना, कि एग्जाम के बाद क्या क्या करना है, कहां कहां करना है. उस तरह के थॉट को जाओ तो आप रिलैक्स भी हो जाओगे, हैप्पी भी हो जाओगे, और आप पढ़ भी पाओगे बेटर. मेरा आप सभी से लास्ट डे में यही एडवाइस है कि प्लीज आप लोग लास्ट डे में सिर्फ पीवाईक्यू को देखो और अपने स्ट्रॉन्ग सब्जेक्ट की ही थ्योरी को पढ़ो. जो सब्जेक्ट आपके ऑलरेडी वीक हैं उनको लास्ट डे में थ्योरी देखने से स्ट्रॉन्ग नहीं होंगे. लास्ट डे थ्योरी देखने से आपके कॉन्फिडेंस पे असर पड़ता है. तो लास्ट डे में जो पीवाईक्यू 4 साल 3 साल में आए हैं, अगर आपने एफएमजी देख लिया है तो नीट को भी देख लो, उसको रिवाइज करो पीवाईक्यू को, और उन स्ट्रॉन्ग सब्जेक्ट की ही थ्योरी देखो जो आपने ऑलरेडी कर रखी है. लास्ट डे पीवाईक्यू एंड थ्योरी ऑफ स्ट्रॉन्ग सब्जेक्ट पे ही रुको. जानवी कह रही हैं रिप्लाई में कि यस सर, जब मैं पीवाईक्यू कर रही हूं तो हो जा रहा है. बस थैंक यू जानवी फॉर रिप्लाइंग दिस. और एग्जाम जानवी किसका है, पीवाईक्यू का. तो यानी आप कितने भी एंजाइटी में होंगे, आपका एग्जाम अच्छा होगा, क्योंकि एग्जाम में थ्योरी नहीं पूछ रहे हैं तो आपको पूरी की पूरी बुक याद हो, इसकी आप कोशिश ही मत करो ना. क्यों पूरी की पूरी थ्योरी याद करनी है, कोशिश बस इसकी करो कि मेरे को पीवाईक्यूज बनते रहे. इसलिए लास्ट डे पीवाईक्यूज प्रैक्टिस करिए और 7-8 बजे सो जाइए. नहीं नींद आ रही है तो भी मत घबराइए. अगले दिन आप एंजाइटी में भी रहेंगे तो भी आप पेन किलर और गैस की गोली खा करके अच्छा परफॉर्म कर सकते हैं. एंजाइटी से हमारी अलर्टनेस बढ़ती है, उससे हमारा रिस्पॉन्स बेटर ही होता है, कोई दिक्कत नहीं होती है. बस आप अपने आप को ये पॉजिटिव बात बोलते रहिए कि थोड़ी एंजाइटी होना नॉर्मल है, पहली बात. दूसरी बात, एंजाइटी कितनी भी हो मैं पीवाईक्यू सही कर लूंगा या कर लूंगी, तो उससे आप रिलैक्स हो जाओगे. और तीसरी बात कि रिजल्ट और एग्जाम मेरे हाथ में नहीं है, मेरे हाथ में है सिर्फ आज अच्छा करना. आप बहुत ज्यादा खुद को जिम्मेदार मत बनाइए. कुछ चीजों को ऊपर वाले पे, नेचर पे छोड़िए, ख्याल ऊपर वाला रखेगा. मैं अपना बस बेस्ट करूं, और कल के एग्जाम को एक गेम की तरह देखिए कि मैं उस गेम में अच्छा खेल के आऊं. रिजल्ट क्या होगा वो ऊपर वाला देखेगा, मैं मजे लेकर आऊं, खेल के आऊं, अच्छे से बनाऊं, ये मेरा पर्पस है. यूजुअली हमारे को जो भी एंजाइटी होती है वो ये सोच के होती है कि घर वाले क्या कहेंगे, पड़ोसी क्या कहेंगे, दोस्त क्या कहेंगे, इन बातों को सोचने लगते हैं हम. लेकिन वही पड़ोसी जब 6 महीने में रिजल्ट अच्छा होगा तो आपकी चाटने भी लगेगा. तो जो इंसान 6 महीने में बदलने वाला है उसकी बात को इतना सीरियसली क्यों ले रहे हो आप. पापा मम्मी की बातों को भी सीरियसली इसलिए मत लो क्योंकि वो दिल से तो बस आपकी खुशी चाहते हैं. तो आप अगर खुश हो तो वो खुश हैं. और सबसे बड़ी बात कि आप बीइंग ए डॉक्टर, आप सब एक अच्छी कमाई, इज्जतदार जिंदगी और फ्यूचर में एक अपने मन के हिसाब से काम चुनने के लिए फ्री हो। डॉक्टर की बहुत सी ब्लेसिंग है जो आप ऑलरेडी पा चुके हो। तो बहुत ज्यादा एग्जाम को हवा मत बनाओ। लाइफ और डेथ का सिचुएशन नहीं है एग्जाम। एग्जाम हर 6 महीने पे होता है। आप बस इस एग्जाम के डे में अच्छा करोगे, उस गेम की तरह देख के वहां परफॉर्मेंस पे फोकस करो, और आप जितना रिलैक्स करोगे परफॉर्मेंस बेटर होगी और वो आपको हेल्प करेगा। फिर भी अगर आपको दोबारा से कभी कुछ लग रहा हो दिक्कत, मैं फिर भी कह रहा हूं प्लीज मुझे फोन करने से ना हिचकिचाएं। मैं हर बार एडवाइस नहीं देता हूं, मोस्टली 90% टाइम मैं सुनता हूं और सुनने से ही प्रॉब्लम सॉल्व हो जाती है। जैसे अगर आपको फिर भी लग रहा हो कि आपकी दिक्कत है जो बड़ी है, तो फील फ्री, मुझे आप अपनी बात बताएं। ज्यादा लोड दुनिया का मत लो। याद रखो, भाड़ में जाए दुनिया, हम बजाएं हारमोनिया। आप अपने पे फोकस करो, अपना एग्जाम बेस्ट दो, रिजल्ट ऊपर वाले पे छोड़ो, रिलैक्सेशन अपने आप हो जाएगा। सारी जिम्मेदारी अपने सर पे लेने पे ही टेंशन होती है ना। तुमने दुनिया का ठेका नहीं ले रखा है, रिजल्ट का काम तुम्हारा नहीं है, रिजल्ट का काम ऊपर वाले का है। तुम्हारा काम है एग्जाम अच्छे से देना। आज पीवाईक्यू पढ़ लेना, अगर कल की कॉपी खोलो तो सिर्फ उस सब्जेक्ट की खोलना जो स्ट्रांग है, और लेट द रेस्ट डू टू द ऑलमाइटी, है ना। डोंट टेक lot of pressure. 30-year person came from China with COVID symptom. What is the test of confirmation? Of course, RT-PCR. And in COVID, remember, if it is PB case, we directly do CB-NAT. CB-NAT in COVID, HIV, diabetes previously treated, and pediatric. In 5 cases, we directly do CB-NAT. Okay. Chalo, doctors doing work and extracurricular activity. If they write extracurricular activity, it means they are taking the same salary but more effective. We are comparing cost effectiveness. This is known as system analysis. If the same question they say we are comparing based on time taken, then answer will become work sampling. बात को समझो. If you opened a hospital and there are 2 surgeons who applied, both are taking 3 lakh salary. One is doing hernia surgery in 1 hour, other is doing in 15 minutes. So work sampling says choose the one who is doing it in 15 minutes. But it may be that the one who is doing it in 15 minutes is connecting wrong wire, and after the surgery, whenever the patient cough, he get an erection. जब भी खांस रहा है उसका खड़ा हो जा रहा है. So in 15 minutes, if you are doing hernia surgery, it may not be the good hernia surgery. But work sampling says to compare based on time taken is work sampling. If you are comparing doctor based on extracurricular activity, that is system analysis. And if you are comparing doctor based on feedback from the last hospital where they work, based on consensus of people opinion, you are taking people opinion that how were these doctor in their last hospital, then this is group method. This is known as Delphi method. So 3 question has came from there. If you are taking group opinion of a group of people, then group method of selecting people, group taking opinion of group and then selecting is Delphi. Choosing based on work, time taken to do work is work sampling. Choosing based on extracurricular activity is system analysis. Okay. Dheeraj Kumar is saying Ford, USAID and all the organization work, please discuss it one time. Why not? So cost benefit means कितना पैसा लगा, कितना पैसा आया. How much money you put, how much money you earn. That is cost benefit. Cost effectiveness means how much money you put and how much life you saved, how much quality of life you improved. That is cost effectiveness. And if you are comparing 2 or more program or 2 or more person cost effectiveness, that is system analysis. Like let's say you are comparing that 3 lakh rupees is 3 crore is needed to open a trauma center and 3 crore is also needed to open a nursing home. But nursing home will save more life. So it means nursing home is more cost effective. So when you are choosing 2 person, 2 doctor based on extracurricular activity or 2 hospital, 2 program based on cost effectiveness, that is system analysis. 2 लोगों को चूज किया कि दोनों सेम सैलरी ले रहे हैं, कौन ज्यादा इफेक्टिव है, या 2 प्रोग्राम को चूज किया कि दोनों हॉस्पिटल में सेम इन्वेस्टमेंट होगा, कौन ज्यादा लाइफ बचाएगा. तो 2 सिस्टम या 2 प्रोग्राम के कॉस्ट इफेक्टिवनेस को कंपेयर करने को सिस्टम एनालिसिस कहते हैं. Okay, network analysis include PERT and CPM. PERT means program evaluation review technique. It means before taking action, we should plan our time. And CPM is critical pathway method. It simply means longest or time taking work should be done first. Okay, so these are some of the things. Now let's come to the request of Dheeraj Kumar, that Ford Red Cross we have to discuss. Okay, I will come to that Ford. Just two more questions left here. A man traveled to Assam, after returning back developed fever, giddiness, investigation confirmed falciparum. Whether it's to Assam, Assam to Delhi, or Delhi to Assam, does not matter. Drug of choice will always be artemether and lumefantrine. Whenever they gave the word northeast state, answer is artemether lumefantrine. And artemether lumefantrine is given in 1:6. If you are giving 40 milligram artemether, you will give 240 milligram lumefantrine. Why always artemether? Because artemether work all over India. But artesunate do not work in northeastern state. That's why in northeastern states we give only artemether lumefantrine. Artemether resistance is not there, but artesunate is resistant is in northeast state. So whenever they measure right northeast, we will not answer artesunate. Okay. Chloroquine is drug of choice for Plasmodium vivax. Okay, and they have given this question last MCI that female is pregnant female with Plasmodium vivax. So what will be the answer? Chloroquine, because chloroquine can be given in pregnancy with vivax. But in pregnant female with vivax, primaquine is contraindicated. We will not give primaquine. Primaquine is also contraindicated in infant and G6PD deficiency. In these three cases, we don't give primaquine. So we will only give chloroquine, which will be the answer. Now, artesunate, sulfadoxine and pyrimethamine, these are the drug of choice for falciparum in other states, not in northeastern states, but this is contraindicated in first trimester of pregnancy. So if they say female is in first trimester of pregnancy in Bihar, what is the drug of choice you will give? So in first trimester, we should, this is the mnemonic by my friend Dr. Ankur Jain, and I was the biochemistry and psychiatry faculty, that we should keep the pregnant mother as queen in first trimester. So in first trimester, we will give quinine. In other states, in northeastern, we will give artemether lumefantrine. This is for falciparum. If it is vivax, then answer is chloroquine. In any state. So do remember artesunate, artemether, these are the two answers. If it is falciparum, it is vivax, answer will only be chloroquine plus primaquine. But primaquine we cannot give in pregnant, so we will remove primaquine option if they talk about infant, G6PD or pregnant female. क्या ये कंफ्यूज तो नहीं कर रहा है? आपको याद है, समझ में आ रहा है? फिर से मैं एक बार रिवाइज कर रहा हूं. वाइवैक्स आंसर है क्लोरोक्विन प्लस प्राइमाक्विन फॉर वाइवैक्स. लेकिन अगर प्रेग्नेंट दे दिया, वी विल रिमूव प्राइमाक्विन, आंसर विल बिकम ओनली क्लोरोक्विन. इफ दे टॉक अबाउट falciparum, falciparum in northeastern drug of choice artemether lumefantrine, in other state drug of choice artesunate. But if in pregnant female falciparum, then we cannot give artesunate, we will give quinine. Okay, I hope it is clear. Chalo. Now, a case control study was done to know the risk factor of obesity. What will be the two group which will be there? Patient with or without obesity. देखो, when they say case control, case means person which with disease, with outcome. Control means without disease. So disease, no disease. That is why case control is known as effect to cause. Effect to cause means परिणाम से कारण की ओर, परिणाम से कारण, परिणाम से कारण की ओर. We are going from the reason, from the outcome to exposure. Effect to cause is case control. And do remember, case control is easy to do for rare disease. It doesn't mean that case control is done only for rare disease. It is easy to do for rare disease. It's not true that case control only for rare. Easy to do for rare. And this is correct, that case control is effect to cause. So the two group must be effect present, effect absent. Parinam present absent will be the two group, outcome present absent will be the two group, disease present absent will be the two group, which is obesity and without obesity. But if they ask it as a cohort study, in cohort the two group is cause present absent, and this option 2 will be correct for cohort. Cause is online food ordering, so with and without online food ordering, that will become cohort. So reason present absent, it is cause present absent is cohort, like option B. Okay. Reproductive Health Program Agency in the world is UNFPA, United Nations Fund for Population Control Activity. As I say, UNDP fund Sustainable Development Goal. UNICEF fund Maternal Child Health Program. That is why in the logo of UNICEF, there is mother and child both. And as I said, UNICEF also fund seed and manure of applied nutrition program. UNESCO fund education and all, the headquarter is in Paris. Now let's come to our Dr. Dheeraj thing. What does Ford fund? Ford fund sanitary latrine and National Institute of Health Administration. तो इसको ऐसे याद कर सकते हो कि फोड़ के हगा, ऐसा हगा कि लैट्रिन फोड़ डाला, and someone defecated this big and broken that sanitary toilet. So after that you have to take a bath. Now you have to knee high, and knee high is the Hindi word, means bath, and you have to take a bath after that big potty. So these two, sanitary latrine and National Institute of Health Administration, fought. Now care, who need care the most? Children. And what is care you can give to them? Good food. So care fund ICDS and Anganwadi, good food. Okay. Then Rockefeller, not Rockford, and a Rockefeller. This is the organization which is giving us fund so that we can do research and has our own patent drug and vaccine, and we will earn crore of rupees. So Rockefeller is making our foundation rock solid by funding National Institute of Virology and Research. So National Institute of Virology and Research is by Rockefeller, keeping our foundation rock solid. Then there is Colombo plan. Colombo, CO for Colombo and CO for Cobalt. Colombo plan fund Cobalt therapy unit. It is funded by Canada, and by taking fund from New Zealand under Colombo plan, AIIMS New Delhi was opened. So Colombo plan Cobalt therapy unit and AIIMS New Delhi. Then last is Red Cross. We all know Red Cross is for disaster management and all. It was formed for initially for war victim relief. Those people who are affected by war, like in Ukraine right now, they will be relieved by that. So do you remember Ford, sanitary latrine, care, ICDS, Anganwadi, Rockefeller, National Institute of Virology, Colombo, Cobalt therapy unit, Red Cross, war victim relief. UNDP, UNICEF, UNESCO, UNFPA, you already see. Now, other than that, you can also remember SIDA, which we did for TB program, DANIDA for eye program. If they say USAID fund malaria program, it looked like USAID will fund HIV, but USAID is also funding malaria program. So these are the organization. Very good, Dheeraj J. Kumar, for asking it. I hope you will revise it and keep it ready. Okay, very good. Now, which agency fund TB program? We already discussed SIDA. Lowest center where patient can go will be sub-center. Lowest center they can say, or they can say first point of contact. First point of contact is sub-center, which can be type A or type B. In type A, there is no delivery, 4 staff. In type B, delivery can occur. So there is one extra A&M trained in conducting delivery, that is there. PHC, we already know, if it is type A, less than or equal to 19 delivery. If it is type B, it is more than or equal to 20 delivery. So 19 is type A, 20 is type B. We already know CHC is the first referral center. CHC is first referral. So do remember this part. In some book they write that CHC can be type A if it is 99 or less delivery per month. and type B if it is 100 or more delivery per month. Okay. Disease caused by following. You can see this mosquito is sitting with a hump, not bump, hump. So this is Culex, and Culex transmit JE, filariasis, and West Nile fever. See, Culex is nuisance because it breeds in dirty water. Dirty water is known as Nali, drainage area. So Nali fever by Culex, JE, filariasis by Culex. Culex is identified by three things. First is hump. You can see the hump. Second is golden brown black bum. And third is hair on the back. This is Anil Kapoor of insect kingdom. Hair on the back, hump, golden brown bum. This is Culex, which transmit these three diseases. Now, if it is sitting with 45-degree angle, this is Anopheles. And Anopheles, first lift the ano, then bite. And Anopheles, so that it do not touch the skin. No touching. And that's why it's sophisticated, is because it breeds in clean water. And they have asked this question, who have spotted wing? So spotted wing is not in Aedes. Spotted wing is Anopheles. Anopheles have a spot on wing. This image is not so clear, but do remember, if it is Aedes, Aedes has black-white stripes on the body, but wing is spotted in Anopheles. Spotted wing, Anopheles. Now, Mansoni is one more thing which they can give in image. Mansoni is a black color mosquito with big mouth biting areas, completely black mosquito, and it transmit Brugian filariasis and breed in root of aquatic plant. Okay, this you have to remember. Breed in root of aquatic plant and transmit one disease, Brugian filariasis. Filariasis is the one disease which is transmitted by all four mosquitoes. Which vaccine has seroconversion time less than incubation period for the disease? Seroconversion means develop immunity. In which vaccine develop immunity earlier than symptom come? This is the question, simple language. किस बीमारी में बीमारी के लक्षण आने से पहले ही बीमारी की रोग प्रतिरोधक क्षमता यानी एंटीबॉडी बन जाते हैं? In which disease we form antibody before developing symptom? Answer is measles. Measles incubation period or symptom come in 10 to 14 days is the time of appearance of symptom. This is incubation period. But immunity develop after 7 days, 7 to 8 days of vaccine. So symptom will come after 10 days, but immunity in 7 to 8 days. So that's why this vaccine is the only vaccine which develop immunity before symptom come. But do remember my point that no vaccine is given in disaster except 3: cholera, typhoid, tetanus. This is the only 3 vaccine given to health workforce. It is also not given to general public, given to the doctor who go there to work. Health workforce during disaster. So during disaster, which thing is not done? Mass vaccination is not done. And we do not give measles also to people in disaster. No measles, no OPV, nothing. Only 3 vaccines are given, and that too to doctors only. So why measles is not given? Because the most common disease during disaster or flood is gastroenteritis. After this, there is leptospirosis, cholera, then rickettsia disease, then mosquito transmitted disease and all. So you can see measles is not a common disease during disaster, so why to give it? Second reason is doctor and nurses are less in number during disaster, so we will never indulge them in vaccination. That is why, remember this thing, no mass vaccination during disaster. No mass vaccination with no vaccine during disaster. Only 3 vaccine is given, and that too only to health workforce. And most common disease is gastroenteritis, which will occur during disaster. So with this, I think I have discussed all the question and images, which is ultra important and need to be remembered. If there is any confusion or anything you want to ask from any part, feel free, let me know. Any problem you are facing, you can always call me on my personal number. Today, I will be free only to attend your calls and only to guide you or relax you. And remember, my friend, whatever you have done, the thing are in your mind. In the exam hall, start giving exam after remembering your mother and Almighty, and leave the result to the God and to the Almighty, and just enjoy that journey of exam. Two things I want to say is that in exam, let's say 10 question came together and you don't know answer of any one of them. It doesn't matter. Don't take that burden forward. Or let's say your first paper did not went well, it's not a problem. Even in the first paper, if you scored 50, by doing 100 in second paper, you can still pass. So if some paper or question is tough, it's okay, you can score later on, and don't take the burden. And they are going to give you question in block, so you cannot go back and revise, and that's a very big blessing, because most 99% people, when they go back and revise, they tick it wrong. So now when the question come, approach it with a positive mind, relaxed mind. If you don't know the answer, try to rule out the option and guess some answer. After ruling out, only guess, and then just keep on doing it. Don't leave it for revision, okay? Because it will be in block. And anyway, when you leave question for revision, the burden is always in your mind. So just keep doing it with a fresh mind. Keep moving ahead. Keep enjoying the journey and play it like a game. And it's a very big blessing that revision is not allowed, and it means it will be blocked, and it's a big blessing. Take it as a blessing only, okay? Dheeraj Kumar said zinc. I don't know why he said zinc, but do remember, zinc will have dryness around nose and mouth, will lead to, if zinc deficiency is there, there will be hypogonadism, less sexual function, and poor wound healing also. And zinc deficiency do not come under RBSK program. Zinc deficiency lead to acrodermatitis enteropathica, dry skin, and loss of intestinal function also. If you have any doubt, any question, feel free, let me know. Thank you so much, my dear friend, for this session. My deepest blessings are with you. दिल से मेरी दुआएं आपके साथ हैं, आशीर्वाद आपके साथ है, और बिल्कुल कूल होके जाओ और रिलैक्स होके माहौल बना के आओ. गो देयर, एंजॉय, हैव योर डे. दिस है ना, जैसे शाहरुख खान वाला डायलॉग था ना कि ये 70 मिनट तुमसे कोई नहीं छीन सकता है. Similarly, this exam day performance will be in your mind as a memory. So try to make good memory. That's your purposes. Don't think result. Think about making good memory, enjoying the day. Okay? And do not go without doing breakfast. Do breakfast, then go in the exam. If you are feeling gastritis, take a gas tablet. If you are feeling pain, better to take paracetamol. Paracetamol will not cause gas and will remove the pain and all. So you can take a paracetamol, Omaze tablet if you are feeling some problems and all. Do drink water, take water with yourself, and do not drink too much of water, of course, and relax. And it's okay. Exam is something which is just occurring every 6 months. It's not life-death situation. Just relax, enjoy the day, and try to make good memory. Let me know if I can help you anyway. Thank you so much. नीट पीजी की डेट आ गई 11 अगस्त. वेरी गुड. सो इट्स फॉर दोज पीपल हु आर फोकसिंग देयर. वी विल मीट अगेन. टिल देन, हasta la vista, das vidania. Thank you so much. Love you all. Keep enjoying the life, and more important, keep enjoying the journey.